Aerosol, air, sol, solution means solute plus solvent. Solute drug, solid, solvent, liquid. Compress air. Aerosol is a pressurized and compressed formulation. History. First time in agriculture field, insecticidal. Medical field, external, internal. In external, topically, example cut, burn, swelling. Internal, local actions like lungs, epinephrine. Aerosol concept was given by scientist Goodhue and Saliver. Advantage of aerosol: fast action, local action, contamination free, tamper proof preparation means no mixing. Disadvantage: dose variation, dose not fixed. Department of Transport test DOT like aerosol. Aerosol container kit, actuator, stem, gasket, spring, mounting cup, housing body or deep tube. Actuator, hard plastic, stem, tail ring, nylon polyamide, gasket, bone iron, neoprene, and natural rubber. And a spring, stainless steel, mounting cup, metal like aluminum, brass, and tin. Housing body, valve body, Delrin and nylon. Deep tube, polypropylene and polyethylene. Actuator, hard plastic. Stem, Delrin, nylon, polyamide. Gasket, bone iron, neoprene, natural rubber. Spring, stainless steel. Mounting cap, metal, tin, aluminum, brass. Housing body, valve body, tail ring, and nylon. Deep tube, polypropylene for metal container, and polyethylene for plastic container. Inside container, air, propellant, pressurized air. Okay, are called propellant, liquid, solvent. Types of propellants: internal, external, compressed gas. Internal for chlorofluorocarbons, O3 harmful, good for asthma. External hydrocarbons, butane, propane, isobutane, isopropane, other hydrocarbons. Flammable gas, good for topical burns. External compressed gas propellant, nitrogen, CO2, NO. Propellant grade rule, CHF rule. C carbon hydrogen fluoride. Rule is structure to propellant number. C minus H plus F no change. C minus H plus F no change. CHF C minus H plus. Aerosol container, metal, plastic. Metal large, pressure 140 to 180 psi. Small plastic polymer less than 25 psi. Metal container, tin plate, aluminum, stainless steel. Tin plate, 3 piece, 2 piece, 1 piece. 3 piece, folding, leakage, corrosion. 2 piece, folding issue increase, leakage decrease, corrosion. And 1 piece, folding, big problem, no leakage, corrosion. Aluminum, folding, minimize. 2 piece, 1 piece. Stainless steel, 1 piece, no leakage, no folding, no corrosion. Plastic polymer structure, glass. Glass 25 psig. Coating, polymeric glass container. Uncoated container, glass. Glass 15 centimeter, no break, good glass. Break, polymer coating, protect. Product concentration: two-phase system, solvent-based system; three-phase system, water-based system. In two-phase, compressed gas, carrier, propellant gas, liquid, solvent. Drug, solute. Compressed gas, propellant, water plus drug. Drug plus propellant improves solubility. Add co-solvent. Hydrophilic drug. Product into drug plus water. Problem, interfacial tension. So minimize. Add by 0.1 to 0.9% surfactant. All surfactant except SLS. SLS, sodium lauryl sulfate, toxic nature. Two-phase product, propellant plus drug. And three phase propellant into drug plus water. Product filling procedure: cold filling method, pressure filling method. Cold filling method not suitable for aqueous material, not suitable for hydrocarbon. Temperature range -30 Fahrenheit to -40 Fahrenheit. Dry CO2, dry acetone. Product normal pipeline, insulating chamber, copper folding, 12 foldings. Weight balance, aerosol container. Aqueous material convert into ice, so not suitable. Pressure filling method: aqueous material, non-aqueous material at room temperature, hydrocarbon, chlorofluorocarbon, and compressed gas. Instrument: piston pump, press, piston, seal. New method: weighing balance. Aerosol evaluation method: general evaluation, propellant evaluation, air and gas chromatography, moisture, gas chromatography, and Carl Fisher titration, and vapor pressure evaluation test, can punching method, and gauze method. Product discharge rate unit gram per second. A 10 container, press for 10 seconds. Foam stability test. Rotational viscometer, rod method. Stability period less than 5 seconds. Particle evaluation test, light scattering method, cascade apparatus, spatial test, leakage test, batch test, random test, continue test, 100% continuous test, continue test, complete test, temperature leakage test for 55 degrees Celsius or 120 Fahrenheit. It also called puncture test. Okay. For sharp minor leakage, water 55 degrees Celsius, 120 Fahrenheit. Result bubbles container, reject, no bubbles, good, accept. Flame test, flash point or flame extension test. Flash point test, filling, liquid propellant, tag open cup apparatus, minus 25 degree Fahrenheit. In flash test thermometer, propellant heat at 55 degrees Celsius, flash temperature. Storage condition, store under below 55 degrees Celsius. Flame extension test, checking propellant quantity 4 seconds for distance 3 feet, extend 3 feet 100% propellant. A spray pattern test, central peripheral, central good pattern, asthma case 15 centimeter, uh, A4 paper, talc plus dye, semi-solid paste. Bad pattern used for topical. Chlorofluorocarbons, asthma. Central, peripheral, spacer technology, long tube attached with aerosol. Valve, continue valve, dose variation, and meter dose valve or meter dose inhaler for meter dose, no dose variation, deep tube plus housing body. Actuator, steam, gasket, spring, mounting cap, housing body. C minus, H plus, F no zero. Difluoroethane 152A, butane A17, isobutane A31, propane A108. A70 produces drier particle, while A17 and A31 produces a wetter spray. Propellant 12, high vapor pressure. Propellant 114, low vapor pressure. Dalton's law, total vapor pressure. Raoult's law, partial vapor pressure. Aerosol container pressure 140 to 180 psig at 139 Fahrenheit. Deep tube diameter, commonly used deep tube 0.120 to 0.125. Capillary deep tube 0.0050. Deep tube for highly viscous 0.195. Actuator diameter, spray 0.16 to 0.040. Foam 0.070 to 0.125. Quality control of pharmaceutical aerosol. Acceptance 54 microliter or less. The limits are plus minus 15 degree. 55 microliter, 200 microliter. The limits are plus minus 10%. Leak testing, checking the crimping of the wall. Flame flame projection. Ruler, product is sprayed for 4 seconds into flame 3 feet. Flash point, tag open curve apparatus at 25 degree Fahrenheit. Vapor pressure, vapor pressure, can punching apparatus, pressure gauge, water bath, density, hydrometer, cyclometer, moisture, Carl Fisher gas chromatography, identification of propellant, IR and GC, foam stability, rotational viscometer, particle size zero point 0.1 to 30 micrometer, cascade impactor, and light scatter decay method. Moisture content in aerosol below 300 ppm. Dry spray product to propellant ratio 6 as to 1. Concentration of surfactant 0.01 to 1%. Non-ionic surfactant sorbitol trioluate and twins. Coating, undercoat vinyl resin, top coat epoxy resin. Next, capsule dosage form, solid, liquid, semi-solid, gas, in-gas aerosols, semi-solid paste ointment, liquid monophasic syrup elixir, liquid biphasic emulsion suspension, unit solid, tablet capsule, bulk, powder granules. Dose, amount, drug, liquid material formulation, solid material formulation, gas material formulation. Solid dosage form, tablet open dosage form, capsule drug enclosed in container, gelatin small container. History of capsule 1730, Pauli scientist, Vienna country, pharmacist. Gelatin protein tasteless, first time capsule used for anti gout. 1834, Joseph Duplass, olive shape. 1846, Julish suggests two-piece capsule. Types of capsule: hard gelatin capsule, soft gelatin capsule. Hard gelatin, two-piece capsule. Soft gelatin, one-piece capsule. In hard gelatin, shell body cap length decrease, shell increase length. In hard gelatin, solid, powder, granule, peel, pellet. Hard. In liquid, non-aqueous material, only semi-solid like soft gelatin capsule, air seal container or hermetic seal container. Gelatin, biological gelatin, biodegradable. 1940 Act, Drug and Cosmetic Act, gelatin as a drug. Gelatin, collagen protein, animal bone, skin, pork and calf skin, and miscellaneous tissue. Animal bone, bone pieces, deep into HCl, 5 to 10%, acid treated, 10 to 15 days. Decalcification, remove contamination, hardness remove. Remove calcium from bone. Base treatment, neutral, lime solution 10%, 1 month process, water wash. Skin, pork, hard skin, acid 1 to 5%, remove hardness, remove contamination, water wash. Calf, soft skin, lime solution, base treated 10%, contamination remove, water wash. Bone, pork, calf, water wash. Extraction plus water. Hydrolytic extraction, filter extract, vacuum concentrate, vacuum drying, air drying gelatin. Gelatin, hydrophilic nature, water soluble, HLB 9.8. Tasteless, proteinous in nature, obtained from hydrolytic extraction. Types of gelatin: Type A, Type B. Type A, acid treated, Pharmagel A, example pork skin. Type B, base treated, Pharmagel B. Bone, calf. Bone, acid, base, water wash. Pork, acid, water wash. Calf, base, water wash. Type A, acidated pork. Type B, bone, calf. Isoelectric points: Type A, acidated, pH 9. Type B, base treated, pH 4.7. Acid base. Pork, pH 9. Bone, pH 4.7, pH 0.47. Okay. Type A, pH 9. Additives used in a gelatin: preservative, methylparaben to propylparaben, 4 to 1 ratio, zero point 0.2 concentration. Flavoring agent, ethyl vanillin, 0.1%. Improve solubility, fumaric acid, formalin, fumaric acid 1%. Decrease aldehyde tanning of a gelatin. Prevent degradation, SO2, 1%. Protection from UV, titanium dioxide, opacifiers 0.2 to 1%. Cross-linking agent, glutaraldehyde, formaldehyde. Sweetening agent, sugar 5%. Coloring agent, red amaranth, green alizarin, yellow tartrazine, blue indigo, black naphthol. Evaluations of gelatin: bloom strength and viscosity. Bloom strength 100 kg gelatin, IP 6.6 to weight by volume, 62 by 30% weight by volume, 20 by 30 weight by volume. 6.66% weight by volume, 10 degrees Celsius for 17 hour. Treated weight plastic plunger not more than 0.5% inch for 4 mm. 50 gram 4 mm no. 50 plus 50. Bloom strength 150 to 250, 4 mm range. Bloom strength 150 to 250. Uh, if less than 150 and greater than 250 bloom strength, gelatin blade, bad. Optimum bloom strength is directly proportional to cost. Bloom strength is directly proportional to mechanical strength, hard. Bloom strength is directly proportional to molecular weight. Bloom strength directly proportional to unfilled gelatin shell. Gelatin. Bloom strength increase, cohesive bond increase. Bloom strength decrease, cohesive bond decrease. Bloom strength, cohesive strength. Bloom strength measure cohesive strength between gelatinous molecule. Bloom strength decrease, bloom strength increase by adding cross-linking agent. Viscosity 60 degrees Celsius per 1 hour melt material. A viscometer Newtonian dilute material. Non-Newtonian concentrated material. Non-Newtonian viscometer cup and pop viscometer. Viscosity 25 to 45 millipoise viscosity of a gelatin, and 150 to 250 uh, bloom strength, and 25 to 45 viscosity. Soft gelatin capsule, soft shell, mainly for liquid, non-aqueous. pH 2.5 to 7.5. More acidic hydrolysis, more basic insolubility problem. Composition of soft gelatin capsule: gelatin, plasticizer or softener plus water, 6 to 10% moisture, and soft gelatin. Sorbitol, glycerol, polyethylene glycol, according to USP. Hard gelatin capsule, gelatin, water, sugar. Plasticizer not compulsory. Plasticizer concentration Condition plasticizer solid, gelatin solid, special point. Hard 0. 0.4 plasticizer, medium 0.6, soft 0.8 plasticizer. Gelatin common 111. Gelatin preparation for soft gelatin capsule manufacturing. Soft gelatin capsule shape round, oblong, oval, olive tube. 270 kg gelatin weigh on a prismatic scale. Mix with a pony mixer. Melt at a 93-degree melted chamber. Steam vacuum control. Vapor pressure 29.5 mmHg. Operational area temperature 20 to 22 degrees Celsius. Humidity 40%. Melted gelatin transfer on a rotary dryer machine 93 degrees Celsius. API semi-solid liquid. Okay. 60 degrees Celsius layer of mineral oil. Prevention of a gelatin adhesion on drum 13 to 40 degrees Celsius. Rotary 37 to 40 degrees Celsius sealing temperature of a capsule. Naphtha bath. Air drying 60% dry, remaining 40% drying by normal drying air vacuum. Hard gelatin capsule 2-part cap body shell. Composition gelatin, sugar, water, plasticizer. Moisture of hard gelatin capsule 11 to 14% or 13 to 16%. Uh, Decrease 10% capsule brittle. Increase 14% reduce mechanical strength. Hard gelatin capsule, empty gelatin capsule, foreign capsule. Capsule in diameter increase, length decrease. Shell in diameter decrease, length increase. Manufacturing process of capsule and shell. C cap, yes shell. Stainless steel pins 22 degrees Celsius, 150 pairs. Gelatin 50 to 60 degrees Celsius. Capsule 2 diameter, thickness shell 1.9, 0.1 meter distance. Dipping, spinning, drying, stripping. Dipping, gelatin loading. Spinning, remove excess gelatin. Drying, aerosol blast. Stripping by bronze jaw method. Stripping, then cutting, also trimming by bronze knife. Capsule short, shelf life long. Quali seal, one side seal. Drug filling, semi automatic machine. Airing, capsule filling, bearing, shell filling. Size of a capsule. Size small 5, 4, 3, 2, 1, 0, 00, 000. 90, 150, 200, 250, 350. 490, 650, 950. 10, 20, 30, 40, 50, 60. 10, 20, 30, 40, 50, 60. 90, 140. 0.15, 0.24, 0.33, 0.44, 0.55, 0.65, 0.95, and 0.135. 90, 150, 200, 250, 350, 500, 650, 900. Advanced machines. Aquagel powder filling in soft gelatin capsule. Aquafill powder filling in hard gelatin capsule. Eli Lilly powder hard gelatin capsule. Formatic Hofiger Kark non-aqueous liquid thixotropic in hard gelatin capsule. Zanasi powder pellets in hard gelatin. Pork Davis powder hard gelatin. Rotofil pellet in hard gelatin capsule. Rotoway capsule evaluator machine weight checking. Vericap 1200 cap evaluator machine separation of filled and unfilled capsule. Rotosort out capsule. Sendinander machine capsule polishing machine on empty gelatin capsule. Iron content in capsule 15 ppm. Iron content in capsule 15 ppm. Disintegration time soft gelatin capsule 60 minutes. Hard gelatin capsule 30 minutes. Base adsorption method material powder form powder 150, liquid 150, suspension form suspension 45 degree. Flow test pass aquagel. Base adsorption a number of grams of liquid base required to produce a capsule forming mixture when mixed with 1 gram of a solid substance. Base adsorption. Moisture content of shell. Toluene distillation method. Hard gelatin capsule most prepared for clinical trials. A decalcification of bone is done to get osin. Entire cycle of capsule manufacturing is 45 minutes. Vericap 1200 major change in a dielectric constant. Erwicacia used for dedusting and polishing machine. PM60 cleaning and polishing machine. Dosators unit dose peeling. Rotograve used for imprinting on empty capsule. Axilla cotta used for dust and polish. Polyurethane or cheesecloth is used. Excipients used in capsule. Binders, mineral oil. Diluents, starch, lactose, bentonite, mannitol, glidants, glycolesters, talc, silicones, lubricants, magnesium stearate, plasticizers, sorbitol, glycerol, glycerin, polyethylene glycol, preservative, chlorocresol, surfactant, polysorbate 80, viscosity modifier, PEG 400 600, fumaric acid, increase solubility of gelatin, formalin, decrease solubility of gelatin, sealing temperature 37 to 40 degree, pH 2.5 to 7.5, spray drying and congealing microcap. Okay, spray drying and congealing microcap. Size reduction, impact and attrition. Okay, impact hammer, attrition friction. Application of size reduction, effective drying, improve solubility, improve dissolution, dosage uniformity. Better size reduction, less moisture material, less than 5%. Mills, types of mills, mesh method. Ball mill, impact and attrition. Ball mill, roller mill, cutter mill, end runner mill, edge runner mill, hammer mill, fluid energy mill, and colloidal mills. Only ball mill and fluid energy mill having impact and attrition. Roller mill, compression, cutter mill, cutting, end runner mill, crushing, and edge runner mill, shearing. Hammer mill, impact. Fluid energy mill, impact and attrition. Colloidal mill, shear stress. Uh, Ball mill, pebble mill, plate mill, ball mill another name, pebble mill, plate mill, tumbling mill, rod mill, cubic mill. Construction, iron chamber material, ball stainless steel, 60 to 70% fill for proper movement. High speed no reduction, low speed no reduction, medium speed reduction. Balls iron chamber heat produce not suitable for thermolabile. Fluid energy mill, air jet mill, ultrafine mill, micron mill, recirculation mill and stationary mill. These are the fluid energy mill. Collect 1 to 30 micrometer. Hopper air 7 kp. 100% output, no heat generate. Laws governing size reduction. Pakoda. Sorry. Laws governing size reduction. Bond बकरी की size cut की बकरी bond kick retinger bond bonds law kicks law and retingers. Okay, kicks law, retingers law, and bonds law. Bakri for size reduction. Pharmaceutical dispensing posology, how much dose, age study. Age group neonates 30 days, infants 365 days, toddler 2 to 3 year, preschool below 5, post school above 5, adolescent 14 to 18, adult 18 to 59, old age above 60, geriatric, elderly 65 to 74, elderly age very old, greater than 85. Young's formula, under 12 year age, 4 to 12 age, child dose, age in year upon age in year plus 12 into adult dose. यंग्स फार्मूला 12. डीलिंग फार्मूला 20 की उम्र में हमें किसी पे दिलाता है. डीलिंग 13 टू 20 ईयर. चाइल्ड डोज एज इन ईयर अपॉन 20 इंटू अडल्ट डोज. काउलिंग चाइल्ड एज इन ईयर प्लस 1 upon 20. Cowling age in year plus 1 upon 24 into adult dose. Bastedo age in year plus 3 upon 30 into adult dose. Infant formula, fried formula, age in month. Child dose age in month upon 150 into adult dose. Clark formula, neonates, pound kg in pound, weight in pound upon 150 into adult dose. In kg, weight in kg upon 70 into adult dose. Body surface area, child dose body surface area of child in a meter square upon body surface area of a adult in meter square into adult dose. Use for topical use, cream, powder, ointment. Body surface area of adult 1.73 meter square. Okay. These are the formulas. Let's see once again. Body surface area, Clark formula, neonates, pound kg, weight in pound upon 150 and weight in kg upon 170. Infant, fried formula, age in month upon 150. Bastedo, age in year plus 3 upon 30. Age in year plus 3 upon 30. Cowling, age in year plus 1 upon 24. Dealing age in year upon 20, young age in year plus 12 plus 12. Prescription medicine, compounding, dispensing, pre-compounding, already prepared, extemporaneous, pharmacist prepared, registered medical practitioner, prescription two types, pre-compounding, already prepared, extemporaneous, prescription with written order for pharmacist, directed by RMP, parts prescription, superscription, inscription, subscription, signature, renewal instruction, superscription, RX, you take, U2, originate sign of a Jupiter, God healing, superscription, NRX for narcotic drugs, inscription, ingredients, subscription, direction for pharmacist, signature, label, signal label, direction for patient, renewal instruction, refill number, doctor sign, RMP signature, name, age, sex, patients, total 9 parts, prescription handling, pharmacist, receiving, reading, collection, compounding, label, Latin terms, kind of preparation, oristil, air, capsula, capsule, tabular, tablet, cataplasma, poultices, cataplasma, poultices, charta, powder, collutorium, mouthwash, collyrium, eye wash, creamer, cream, emulsio, emulsion, suppositorium, suppository, house toss, draught, volume, injectio, injection, insufflio, insufflation, linctus, linctus, linimentus, liniment, lotion, lotion, liquid, liquid, mixtura, mixture, naristyle, nasal pathway, nebula, nasal spray, pasta, paste, pillula, pills, pulvis powder, unguentum, ointment. Method of administration, addendus to be added, applicandus to be applied, dandus to be given, summandus to be tear, summandus, dandus to be given, summandus to be given, capiendus to be taken, degludiendus to be swallowed, miscendus to be mixed, utendus to be used. Time of administration, die, day, nocte, night, main, morning, inter, between, vesper, evening, omni, every. Simil indi once a day, bis indi two times a day, ter indi three times a day, quarter indi four times a day, omni main every morning, omni nocte every night, sibos meal, antisibos before meal, postsibos after meal, intersibos between meal, dolor urgentum, chronic pain condition when pain is severe, auris ear, oculis eye, jugular throat, dexter right, levulus left, auris dexter right ear, oculis dexter right eye, auris levulus left ear, oculis levulus left eye, pro-oculis for the eye, gutta drop, quantity volume, cochlear magnum medium minima, 1 drop 0.04 to 0.6 ml, 1 teaspoon 5, 1 dessert 8, 1 table 15, 1 wine glass 60, 1 teacup 120, 1 tumbler 240, samplum 240, sterno chest, lactate milk, fiat milk, pearan needed, orasomni at bedtime, sauce necessary, sisopsit, PRN needed, sisopsit necessary, oris oral, lente slowly, statin immediately, gentaculum breakfast, signa label, crass tomorrow, omnivora every hour, aqua distilla water, 1 drop 0.04 to 0.6, 1 teaspoon 5, 1 dessert 8, 1 table 15, 1 wine, 1 tea, 1 tumbler, horasomni at bedtime, HS at bedtime, orasomni at bedtime, cis necessary, oris oral, lente slowly, starting immediately, gentaculum breakfast, signa a label, crass tomorrow, omnivora every hour, aqua distilla water. Pre-formulation, pre-formulation, pre-form product, powder, tablet, capsule, syrup, ointment, powder, granules, solid, 90% cases, check solid factors. Goal, objective of pre-formulation, study of additives, study of physical properties, study of chemical properties, study of solubility, study of pharmacokinetic activity, study of clinical trials. Frame, planning, physical, chemical, solubility, organoleptic characters, physical, bulk property, particle size, powder property, angle of repose, compressibility index, porosity, crystalline property, chemical, polymerization, racemization, neutralization, hydrolytic reaction, oxidative reaction, reduction reaction. Solubility pKa, solubility, dissolution, BCS classification. Organoleptic property, taste, color, flavor. Physical property, bulk property, particle size determination. Optical microscopy, sedimentation method, counter sieve method. Micromeritics measure 10 raised to minus 3 millimeter, 10 raised to minus 6 micrometer, minus 9 nanometer, minus 12 pico, minus 50 femto. Optical microscopy 1 kg, 2 ml solvent insoluble slurry, 1 ml dry optical microscopy. In optical microscopy, zero point 0.2 micrometer to 100 micrometer. Sedimentation 0.1 to 200 and counter zero point 0.5 to 500 micrometer. Sieving 50 to 1500 micrometer. Okay. So optical zero point 0.2 200, sedimentation 0.1 to 200 and counter zero point 0.5 to 500, sieving 50 to 100. Powder flow property, porosity, void space, interparticle space, intraparticle space, bulk volume space. High porosity, flow property decrease, less porosity, flow property increase. Angle of repose powder heap of pile, theta r h 2 centimeter horizontal plane, tan theta equal to h upon r, theta equal to tan inverse h upon r. Angle of repose, angle between heap of pile and horizontal plane. Result analysis, angle of repose less than 25 excellent, 25 to 30 uh, good, 30 to 40 passable, and greater than 40 poor. Okay. Angle of repose only 4 conditions: 25 to 40, less than 25 excellent, 25 to 30 good, 30 to 50 passable, and greater than 40 poor. So compressibility index, also called as a Kars index, based on a tap method. Maximum space, maximum compression. Okay. High void space, maximum compression, poor flow. Less void space, minimum compression, good flow. Result: 5 to 15 excellent, 12 to 16 good, 18 to 21 passable, 23 to 35 poor, 33 to 38 very poor, greater than 40 very very poor. Okay. Again, compressibility index, Kars index: 5 to 15 excellent, uh, 12 to 16 good, 18 to 21 passable, 23 to 35 poor, very poor, very very poor. Crystallization for purification: drug, solvent, saturate, heat, supersaturate, at rest, loose aggregates, embryo, nuclei, nucleation, crystallization. Other methods of crystallization: heat, cooling, add additives. Amorphous, metastable, crystallizable. Solubility: amorphous, metastable, then crystalline. Dissolution: amorphous, metastable, crystalline. Melting point: crystallizable, crystalline, metastable, amorphous. Solubility: water, crystal hydrated, organic solvent, crystal solvated, pseudomorph. Isomorph: two crystals, same shape, size. Polymorph: more than two crystals, same property. Chemical property: racemization, optical active, inactive. Polymerization: addition of a monomerization. Homopolymerization: same monomer units. Copolymerization: different monomer units. Neutralization: basic drug, increase acid, acidic salt. Acidic drug, increase base, basic salt. Ammonium hydroxide, hydrochloric acids, ammonium chloride, salt, water. Hydrolysis: salt, water, acid plus base. Oxidation: addition of oxygen, reduction, addition of hydrogen. Solubility parameter, part of solution in 1000 ml. VF triple CP: very soluble, freely soluble, soluble, sparingly soluble, slightly soluble, uh, soluble, sparingly soluble, slightly soluble, very slightly soluble, sorry, very soluble, freely soluble, soluble, sparingly soluble, slightly soluble, slightly soluble, very insoluble, practically insoluble. Okay. Less than 1, 1 to 10, 10 to 30, 30 to 100, 100 to 1000, 1000 to 10,000, greater than 10,000. BCS biopharmaceutical classification: check solubility and permeability. Class 1, SP, high high, low high. Second, low high, high low, low low. Diltiazem, nifedipine, Taxol. Diltiazem, nifedipine. Class 1, diltiazem, nifedipine, insulin, and Taxol. Dissolution study, dissociation constant pKa, solid compound, pH, liquid compound. Acidic drug, acidic medium, ionization. Acidic drug, basic ionization, basic acidic ionization, basic ionization, ionization, deproteination. Organoleptic character, sweetening agent, flavoring agent, coloring agents. So parenteral, it's a sterile product, drug administered into systemic circulation. Advantage, free from microorganism, fast action, maximum bioavailability, IV 100%. Highly suitable for comatose patient, good for unconscious patient. Disadvantage, painful preparation, not suitable for children patient. Highly costly, unstable preparation, cannot remove from body. Route of administration, intradermal, IV, subcutaneous, intramuscular. Angle, in intradermal 15 degree, IV 25, subcutaneous 45, intramuscular 90. In dose, intradermal 0.1 ml, IV 1000 ml or more, subcutaneous 1 to 1.3 ml, and intramuscular in gluteus maxima 5 ml and midlateral 2 ml, in deltoid 2 ml. ID, IV, subcutaneous IM. Only IV, only aqueous material through IV. Otherwise, suspension, solution, emulsion, aqueous and non-aqueous by intradermal, subcutaneous and intramuscular. BCG vaccine intradermal, saline solution IV, insulin subcutaneous, oily solution intramuscular. Okay. In IV, only aqueous material. In intramuscular, oily solutions. Minor route intraspinal 10 ml, intraperitoneal 2 to 20 ml, intraartery stepwise any volume. Intraspinal, intraperitoneal, only aqueous material, intraperitoneal in joints. Parenteral products, saline, irrigating, implant and ophthalmic. In saline product, old container, glass, painful container, new container, plastic, painless container, PVC polymer, low dose polymer, low dense polymer. Types, DNS, dextrose, normal saline, in which 5% dextrose plus 0.9% weight by volume sodium chloride. Work, dehydration, energy loss. NS, normal saline, in which only sodium chloride 0.9% plus 100 ml water. Wound cleaning, dehydration, blood loss. Retinger lactate, RL, retinger lactate electrolyte, sodium, potassium, calcium chloride plus lactate. Electrolyte balance. D 5%, dextrose 5%, minor energy loss. D 10%, dextrose 10%, medium energy loss. D 25%, dextrose 25%, major energy loss. Irrigating solution, cavity cleaning solution, vagina irritating solution, Duchess, rectal irrigating solutions, enemas. Implant product in subcutaneous layer under the skin, life 1 month to 1 year. Implant device, corn injector. Ophthalmic dosage form, eye drop, eye suspension. Side effects of eye suspension is a irritation, eye ointment, eye cream, contact lens made from hydrophobic polymer. Disposable syringe made up by polypropylene, melting point 163 to 165 degrees Celsius, hard polymer, plunger, valve, barrel, inside product, bowel, also called needle, made up of stainless steel. Bowel needle, thickness, gauge number. Gauge number decrease, needle size increase. Gauge number 16 to 29. 16 large, 29 small. Basic parenteral container, ampoules and vials. Ampoules made by glass, vials also made by glass. In ampoules, nitrogen fill inside, sensitive product, single time use, single dosage form. In vials, less sensitive product, multiple time use, multi-dose container, multi-dosage form. Ampoules, preservative must be added, 10 ml capacity. Vials, preservative, 30 ml capacity. Ampoules added. Uh, small volume parenteral SVP, size 1 ml to 100 ml. Example, ampoules and vials. In a large volume parenterals, size 100 ml to 1000 ml. Saline bottle. Pyrogen, microorganism, bacteria, fungus, virus, spores, other. Bacteria more in environment. Bacteria gram positive, gram negative. Gram negative active metabolite, endotoxin, release pyrogen. Pyrogen is made by lipopolysaccharide, lipid soluble. Product pyrogen, inject body, hydrophilic, lipophilic. Lipophilic cross blood brain barrier, in brain, stimulate COX, cause fever. Sterile temperature 210 degrees Celsius for 3 to 4 hours and 650 degrees Celsius for 60 seconds. Vehicles, aqueous vehicle, non-aqueous vehicle. In aqueous vehicle, water for injection, sterile water for injection, bacteriostatic water for injection, sodium chloride solution, ringer solution. In non-aqueous vehicle, water miscible, dioxane, diethyl acetamide, polyethylene glycol, polypropylene glycol. Water miscible, water immiscible like 8. Okay, water immiscible F by benzyl benzoate, isopropyl myristate, fixed oil like castor oil, sesame oil, cottonseed oil, peanut oil also called groundnut oil, and ethyl oleate. Normal water purified distillation made by water for injection. After sterilized by autoclave, its form sterile water for injection. After that, adding preservative, bacteriostatic water for injection. Purified water, ions free. Sterile water, microorganism free. Water purified method, battle distillation and reverse osmosis. Method of preparation of a aqueous vehicle, battle distillation. Normal water, round bottom flask. Battle, turbulent flow, distillation, water for injection, pure water. In reverse osmosis, osmosis means solute plus solvent, solute decrease, solvent increase in low concentration. In higher concentration, solute increase, solvent decrease. So, SPM, semi-permeable membrane. Osmosis, movement of solvent, lower concentration, solute zone, higher concentration, solute zone. Okay, are called osmosis. In reverse osmosis, movement of solvent, higher concentration solute zone to lower concentration solute zone. Aqueous vehicle condition, water for injection not need sterile, pyrogen free. Sterile water must be sterile, pyrogen free. Bacteriostatic must be sterile, pyrogen free, added preservative. Sterile water for injection, add 0.9% weight by volume sodium chloride solution, sterile, pyrogen free. Add sodium, potassium, calcium chloride, Ringer solution, sterile solution. Storage condition of aqueous vehicle, water for injection, not held at room temperature, 24 degree hour, hold at 80 degrees Celsius, but continue addition of extra water for injection. Sterile water for injection, at room temperature, capacity 1 liter container. Bacteriostatic, room temperature, anytime, capacity 5 ml to 5 liter. Sodium chloride and ringer, no special storage condition. Aqueous vehicle evolution test, conductivity test. Water for injection, high glow, high conductivity, impure water because presence of ions. Low glow, low conductivity, pure water because non-ionic water, good for injection preparation. Thermogravimetric analysis, TGA. Water for injection, total solid content 10 ppm, total organic content 500 ppm, 500 ppm. Okay, and sterile water for injection, total solid content 40 ppm. Water for injection, total solid content 10 ppm. Don't confuse. Water for injection, total solid content 10 ppm. Total organic content 500 ppm. Sterile water, total solid content 10 ppm. Additives of parenteral, antioxidant, tonicity modifier, buffering agents, and preservative, bacteriostatic millitimes 99%. In vitro drug, in vivo in body. Okay, in vivo metabolism liver by phase 1 reaction, phase 2 reaction. Phase 1, oxidation, reduction, hydrolysis, cyclization and decyclization. In phase 2, acetylation, methylation and conjugation. In vitro, oxidation, reduction, hydrolysis, degradation. Oxidation prevention, store in a dark place, a 322 nanometer wavelength, amber colored, so no need to antioxidant. Transparent antioxidant. Oxidation fast, reducing antioxidant. Oxidation slow, blocking antioxidant. Okay. Fast oxidation, aqueous injection, adding reducing agent. Slow oxidation, non-aqueous injection, addition of a blocking agents. Hydrolysis, drug plus water, product hydrolysis. So convert product into dry injection, powder plus sterile water for injection. Antioxidant, reducing antioxidant, all are sodium like sodium metasulfate, sodium bisulfate, sodium metabisulfate, thiosulfate, thiourea, and ascorbic acid, vitamin C, reducing agent. Blocking antioxidants for non-aqueous like BHT, BHA, DHA, vitamin C, butyl hydroxytoluene, butyl hydroxyanisole, dihydroxyanisole, ascorbic acid ester, and alpha tocopherol means vitamin E. Synergistic antioxidant cat, citric acid, ascorbic acid, tartaric acid. Okay, complex antioxidant EDTA, citric acid, synergistic antioxidant, citric acid, ascorbic acid, and tartaric acid. In reducing antioxidant, sodium metabisulfate, sodium bisulfite, sodium metabisulfate, thiosulfate, and thiourea, ascorbic acid, vitamin C. Blocking agents for oxidation. Okay, and non-aqueous reducing agent for red. Okay, fast oxidation, aqueous reducing agent. Slow oxidation, non-aqueous injection, add blocking agents. Buffering agents ends with 8, citrate, tartrate, borate, and phosphate. Tonicity modifiers to maintain glycerol like gym, glycerol, mannitol, isosorbide. Preservative, benzyl alcohol. Container, glass, plastic. Advantage for glass, transparent, chemically inert. Disadvantage, handling issue, heavy weight. In plastic, advantage, flexible, lightweight. Disadvantage, not fully transparent, sometimes chemically reactive. In glass, chemically, silicon oxide, okay, silicon dioxide, glass. Raw material, melt 1300 degree Celsius liquid. Solid plus XYZ, melting point decrease. Liquid plus XYZ, boiling point increase. Silicon dioxide, oxide, soda lime. In oxide, boric oxide, aluminum oxide, magnesium oxide, sodium oxide. Silicon dioxide plus boric oxide, 800 degrees Celsius, borosilicate glass. Silicon dioxide plus soda lime glass. Hydrogen sulfide gases द्वारा treated soda lime glass. Okay, general purpose glass, fourth one. Borosilicate glass, soda lime glass, treated soda lime glass, and general purpose glass. According to quality classification, type 1, type 2, type 3, type 4. Type 1, borosilicate glass, treated soda lime glass, and general purpose glass. Type 1 to type 3 parental, and type 4 non-parental. According to generation 1, 3, 2, 4. Application type 1, buffering agent, aqueous material, non-aqueous material, acidic base. Type 2, same as type 1 but dry powder, oleaginous base. Type 3, dry powder, oleaginous base. And type 4 for tablet capsule oils. Major disadvantage of glass container, leaching. Chemical release from container and mix with the product. Silicon dioxide plus oxide, soda lime. Chemical alkaline. Leaching test, powder attack test, and outer attack test. Powder attack test for type 1, 3, and 4, and outer attack test for type 2. Powder attack test 1, 4, 3, 1, 3, 4. Okay, 1000 randomly selected 6 container, milling size reduction by mortar and pestle. Powder particle size 25 micrometer, 25 micrometer millimeter. 100 gram powder, 3 parts, take 1 part. Third, again milling fine powder 10 gram, 15 micrometer, 15 mm. 10 gram fine powder magnet, iron free powder, transfer in a conical flask 50 ml, 10 gram distilled water. Autoclave 121 degrees Celsius for 30 minutes. Autoclave 121 degrees Celsius for 30 minutes. Glass water sample alkaline titration acid base. Indicator methyl blue acid 0.02 molar H2SO4 base. In 1 ml H2SO4 neutral, then type 1 acceptance. 8.5 ml H2SO4 neutral type 3, and greater than 15 ml neutral type 4. Okay, remaining 2 parts reserve. Outer attack test type 2 chemical resistance glass. Outer attack test, and powder attack test 134. Soda lime make reduction, hydrogen sulfide. Treated soda lime break reduction, fume SO2. Fill autoclave 121 degrees Celsius for 1 hour. Sample size 100 ml or more. Then 0.2 molar H2SO4 neutral, and less than 100 ml zero point 0.7 and H2SO4 neutral. So these are the table. Borosilicate glass type 1 1 ml pass. Treated soda lime glass, water attack test, if 0.2 ml then pass 100 ml and more, and 0.7 ml pass less than 100 ml. It's opposite like soda lime glass 8.5 ml and general purpose glass 15 ml. So these are the important topic. 1 ml 1.1 ml, 8.5, 15 ml, zero point 0.2, 100 or more, zero point 0.7 less than 100. Plastic container, polymer container, flexible, not need sterile, lightweight, handling easy. Polymer use polypropylene, polypropylene, polystyrene, polyethylene, polyvinyl chloride, polyamide nylon, PVC for a saline bottle, polystyrene and polyethylene for ophthalmic container, and polypropylene disposable syringe. Polypropylene high dense polymer, hard polypropylene. Polystyrene and polyethylene low dense polymer for ophthalmic container. Disadvantage of plastic container: leaching, air permeability, and adsorption. Leaching, air permeability, air contamination, adsorption, drug amount decrease. Polymer leaching test. Implantation extraction, solvent mainstream. In implantation, polymer small pieces. Insert rabbit minor cut. Implant polymer 24. Kill leach fail. Alive not leach pass. In solvent same with solvent alcohol, solvent without alcohol, and solvent with polyethylene glycol sesame oil. Heat, filter, filtrate, filling in vials. Result alcoholic extract IV mice inject. Without alcoholic extract IV mice inject. Polyethylene glycol sesame oil extract IV inject. All extract mixture dose subcutaneous rabbit kill toxic live non-toxic. Production area suggested by SOP QA QC standard operating procedure quality assurance quality control. Grade A class 100, grade B class 10,000, and grade C class 1 lakhs. Grade A aseptic area, grade B buffering area, and grade C storage area. Okay. Grade C storage area. In aseptic area, filling and sealing. In buffering area, compounding, dispensing, filtration, and sterilization. And filling, sealing. And grade C only raw material store. Person entry class C BA. Product passed pathway CBA. Air pressure ABC. Cleaning phase ABC. Like that, clean room, weak clean, moderate clean, wall coating by ceramic material, joint by epoxy material, show head cam glass apron cloth safety kit. Guidelines: sharp corner all not allowed, round all allowed in a production area, floor coated by ceramic material, two stones, two tiles joined by epoxy resin material, window not allowed, for communication purpose only allow, airlock mobile, plastic iron wooden furniture is not allowed in production area, only stainless steel metal furniture allowed, authorized person allowed in production area, head cap shoe glass glow in, sterile solvent sterile solvent disinfectant fluid, gown made by Dacron polymer. ABC class 100, class 10,000, class 100. Aseptic area, buffering area, storage area. A micro size 0.5 to 5 micrometer. Count 100 particle count. Okay. No, 0.5 to 0.10,000 and HEPA filter, high efficiency particulate matter, efficiency 99.99% to 99.97%, air speed 100 plus minus 20 feet per minute, another name laminar airflow, pore size not more than 0.3 micrometer, dye dioctyl phthalimide black color, HEPA membrane 0.3 micrometer size, pre-filter glass, asbestos and plastic, pre-filter glass, asbestos, plastic, laminar air 100 plus minus 20 feet per minute, and dop test black color convert into completely dull, decreased efficiency, carcinogenic dye, PAO test para alpha olefin, PAO, para alpha olefin non carcinogenic dye, bubble test efficiency maintained period 6 months, expired 1 year. Okay. HEPA filter efficiency maintained period 6 months, expired 1 year. Evaluation parameter of parenteral product: sterility test, filter membrane test, direct inoculation, pyrogen test, in vivo rabbit, in utero lal, leakage test, clarity test. Let's see by sterility test, filter membrane test, FMT, testing bacteria fungus, spread peptic digest solution, filter membrane completely wet, pore size 0.5 or 0.45 micrometer, filter membrane. Microorganism product filter membrane cut into two same parts, aerobic fluid thioglycolate bacteria, soybean casein media. Okay, fungi. 7 to 14 days under observation, growth contaminated product, no growth sterile product. Direct inoculation test product fluid thioglycolate media, Soybean casein media 7 to 14 days growth contaminated, no growth, sterile. Pyrogen test rabbit in vitro, in vivo inside the body of rabbit, lal outside in vitro rabbit test, pre-rabbit test, qualifying test, sham test, final rabbit test, sham test, no selection limit, 1 rabbit, 2 rabbit, 20 rabbit, before injection count temperature. Okay. Marginal vein ear IV product injection, inject at 10 a.m. at check 5 a.m. after 7 hours, monitor temperature difference, individual temperature of each tablet not more than zero point 0.6. Okay, if not more than zero point 0.6, pass sham test, final rabbit test, first phase 3 rabbit adult. Okay, combined weight not more than 1500 gram, combined weight not less than, okay, not less than 1500 gram, before count temperature IV inject, individual temperature of each rabbit not more than zero point 0.6, combined temperature not more than 1.6. If combined temperature go to greater than 1.6 temperature, then go to second phase 5 rabbit IV inject, individual temperature zero point 0.6, combined temperature 3.7, not more than, temperature checking route rectal. Okay. Lal test, also called as bacteria endotoxin test, BET, bacteria endotoxin test or lal test. Lal for limulus amoebocyte lysate, L for limulus crab, limulus polyphemus, horseshoe crab, amoebocyte cell, and lysate enzyme. Semi qualitative test, 5 to 10 times more potent than rabbit. BET bacterial endotoxin test. Lal solution parental product rest 1 hour 37 degrees Celsius. Pyrogen present lysate release gel formation cloudy turbidity. Pyrogen absent no lysate release no gel formation clear. Leakage test container test ampoules saline bottles water plus 0.5% 1% methyl blue blue water blue color ampoule leakage ampoule under vacuum pressure 27 mm of Hg. Test on all 100% containers. Leakage high frequency spark test. Spark only for ampoules. Okay. Crack 15 micron. Crack not detected by water leakage. Clarity test. Solid particulate test. Only for large volume parentals. Clarity chamber apparatus. White black zone. White black. Large volume parental white zone. Black other color particles. And black zone white particles. Other particle size observation method: optical microscopy, eye observation, visual method, color counter, light obstruction test. Prescribed limit acceptance bacteria: 10 micrometer, 15 particle per ml, 25, 5 particles, and 50 micrometer, no particles. Ampoule seal method: pool sealing and tip pooling. Ampoule and vial material filling process: volumetric filling. Okay. Next, ointment. Ointment semi-solid dosage form, semi-solid, 50% liquid, 50% solid, maximum insoluble solid, liquid aqueous or non-aqueous, solid put into liquid. So if soluble, then solution, insoluble, then semi-solid, viscous matter, suspension, biphasic liquid, semi-solid viscous material, ointment paste, skin lipophilic ointment, topical semi-solid dosage form. Ideal properties: non-toxic, non-irritation, better release, easily washable. Types of ointments: medicated or non-medicated. In medicated, base plus drug API. Example: burn therapy, minor cut. Non-medicated, base plus flavoring agent. Example: cosmetics. Types of bases: oleaginous base, absorption base, emulsifying base, water soluble base, water soluble greaseless base. Oleaginous base: hydrocarbon, petrol atom, soft or liquid petrol atom, and hard, soft, hard, and liquid. In soft petrol atom, original petrol atom, yellow soft petrol atom, bleaching agent डालने के बाद white soft petrol atom, not used in ophthalmics. Hard petrol atom present solid hydrocarbons, liquid present liquid hydrocarbons. Oleaginous manner maintaining by peanut oil, sesame oil, or almond oil. Fatty acid maintains by stearic acid, palmitic acid. Oilic antioxidants BHT, BHA. Butyl hydroxy toluene and butyl hydroxy anisole. Special type hydrocarbon ozokerite. Natural hydrocarbon ozokerite plus paraffin wax, kerosene wax. Absorption base or anhydrous base or non-emulsifying base. Example: ulfat, anhydrous lanolin, and hydrosulfate lanolin. Hydrosulfate 70% wool, 30% water. Insoluble in water, stable soluble in alcohol. Beeswax, yellow beeswax after bleaching, white beeswax. Emulsifying base, O by W base, W by O base. O by W base mostly used cetrimide, cetramacrolol, easily washable. And W by O base, lanolin, hydrosulfate. Water soluble base, oil free, polyethylene glycol. Macrogol, carbovax. Macrogol mainly in suppository and carbovax mainly in a ointment. Method of preparation, trituration method, base plus drug, triturate. Fusion method, principal melting point, higher melting point, added late, and lowest melting point, higher late, and highest melting point, boil first. Chemical method, X plus Y sodium chloride reaction, sodium chloride blaze ointment. Iodine plus potassium iodine, betadine iodine. Evaluation test of ointments, D content test. Ointment में ड्रग कितना है चेक करेंगे. 100 ग्राम ड्रग प्लस बेस soluble filter drug weight check label base. Release medicament from base. Check base quality. Antibacterial ointment. 1 gram use zone of inhibition culture media. Absorption test, apply ointment on skin, goes in blood, check blood sample. Penetration enhancer, DMSO, DMF, ethanol, polypropylene glycol, SLA, sodium lauryl sulfate, octanol, trantol, DMA, dimethyl acetamide. Okay, DMA, dimethyl acetamide, DMSO, dimethyl sulfoxide, and DMF, dimethyl formamide. These are the penetration enhancer. Next, suppository, dosage form, solid, su- suppository base, semi-solid. Suppository insert body cavity, rectal, vaginal, urethral, ear, nose. Melting point of suppository 37 degrees Celsius, same as a body part temperature. Suppository gives local action. Types of suppository, first, rectal suppository shape, torpedo shape. In adult 2 gram, in child 1 gram. Rectal vaginal suppository uh, shape, globular shape, OV shape. Female 3 to 5 gram, also called vaginal suppository, pessaries. Urethra, also called buggies, pencil shape, male 4 gram and female 2 gram. Urethral buggies. Nasal suppository 1 gram, cylindrical shape. Ear suppository 1 gram, bullet cylindrical shape, also called urinaria. Ideal properties of suppository, non-toxic, non-irritant, non-sensitive, water number is high, acid number 0.2, saponification number 200 to 245, iodine value below 7. These are the three main components. Acid number 0.2, saponification number 200 to 245, iodine value below 7. Suppository base, oleaginous base, aqueous base, emulsifying base. Oleaginous base, cocoa butter, theobroma cocoa. Aqueous base, glycerinated gelatin, subglycerin or polyethylene glycol, macrogol. Emulsifying base, white sol, masopol, massa styrenium. Okay, these are the emulsifying base. Example, cocoa butter, theobroma cocoa, purine alkaloids. Triglyceride in nature. Triglyceride in nature, melting point 30 to 34 degrees Celsius. Crystal pattern, theobromoform alpha, beta, beta dash, gamma. Iodine number 34 to 38. Acid number 04. Okay, iodine number 34 to 38. Acid number 04. Alpha form 24-degree melted. Sudden cold 0 degrees Celsius. Alpha. Beta form 28 to 31 degrees Celsius melt stirrer and 18 to 23 hold beta dash. Gamma form 18 degrees Celsius melt attest gamma form. Melting point alpha 24 degrees Celsius, beta 34 to 35 degrees Celsius, beta dash 28 to 31, gamma 18 degree. So good form is a beta. Solidified temperature of a theobroma cocoa is 15 degrees Celsius. Solidified temperature of theobroma cocoa is 15 degrees Celsius. Spatial suppository, layered coated suppository, melting point 37 to 38 degrees Celsius. Soft gel suppository, as similar soft gelatin capsule, rectal 2 to 1 gram, vagina 3 to 5 gram. Hydrogel suppository, sustained release, macromolecular, polymer network, PVA, polyvinyl alcohol, polyacrylate. Swell in cavity, not dissolve. Swell in cavity, not dissolve. Method of preparation, hand molding, hand rolling machine. Poured method, fusion method, pouring, cooling, removing. And cold compression method for thermolable substances. Evaluation test of suppository, Melting point evaluation test, macro outer bath method for suppository dosage form, and micro capillary method for suppository base. Okay. Softness test, rod dose, sticky test, round test, twinning, staking, chipping. Displacement value only for suppository base. Base melt liquid plus drug solid. Amount of base displaces via drug are called displacement value of a base. Next, ophthalmics. Ophthalmics basic requirements: free from microorganism, free from foreign particle, not need to sterile to maintain, not need to sterile. Okay, no sterility, no maintain pH, no maintain to maintain isotonicity. Okay, but sterile की जरूरत नहीं होती sterility. लाल rabbit test not perform on ophthalmics. I harmful microorganism Pseudomonas aeruginosa. I product pH 7.2 to 7.4. Particle size non-irritating less than 10 micrometer. I drop viscosity 15 to 25 CPS. Okay. I product tolerate pH 3 to 10 pH. Main viscosity 5 15 to 25 CPS. Okay. Ophthalmic products: eye drop liquid, contact lens solid, eye suspension, eye gel, eye cream, eye lotion, eye ointments. Semi-solid, semi-liquid eye products disadvantage: eye suspension, insoluble particle, cause irritation. Eye suspension, eye ointment, eye lotion, eye creams, gel viscosity increase than 25 CPS. Stick on a eye, vision interface. Contact lens, contact lens solid, polymer, hydrophilic or lipophilic. In hydrophilic, HEMA like soft contact lens not suitable, and lipophilic stables, PAMA hard contact lens. HEMA means hydroxyethyl methacrylate, and PAMA polymethamethacrylate. Okay. Kept non-ionic surfactant, water soluble, oil soluble. Twin, नॉन आयोनिक में भी कौन सा होना चाहिए? ट्विन होना चाहिए, ना कि स्पान. If ionic surfactant use, lens power disturb. Eye drop 1 drop equal to liquid 50 microliter product. Eye cavity cul-de-sac 30 microliter. In drop waste product 20 microliter. Stabilizers, additives, antioxidant, sodium metabisulfate, sodium editate, sodium metasulfate, ascorbic acid. Thickening agents, viscosity enhancer, methyl cellulose, CMC, povidone, dextran. Buffering agent, maintain pH, borate, citrate. Weighting agent, surfactants, polysorbate 80, twin 80. Preservative, benzalkonium chloride, benzothonium chloride. Also benzalkonium chloride, quaternary ammonium compound, chlorobutanol, phenyl mercuric nitrate, phenyl mercuric citrate. Okay. Method of preparation: sterile container plus preservative, antioxidant, buffering agent, tonicity modifiers. Example: sodium chloride, glycerol, mannitol, boric acid, plus drug. Filter from membrane 0.2 micrometer. Container glass. Example: borosilicate glass. Polymer polyethylene or polystyrene. Teat frozen cap, dropper tube. Container maximum volume. Okay, max volume. Use within 30 days after opening. Metal container for eye ointment. Irritation test for all ophthalmics, mainly eye suspension. Which test? Drace test. Rabbit eye cornea product load 14-day observe eye red, irritation positive. Sterilization filtration 0.2 micrometer filter membrane for eye drops only. Radiation sterilization cobalt 60. Eye ointment, eye suspension. Autoclave 15 minutes 121 degrees Celsius. Gas sterilization ethyl oxide. Ocular tension measured by tonometer. Filtration thermolabile IVB 45 degrees Celsius less no safe. Thermostable IVB 45 degrees Celsius increase safe. Okay. Biological fluid animal biological use biological origin. Container biological products, biological fluid biological products, biological origin. Thermolabile टेम्परेचर की वजह से खराब होते हैं. Filtration cold sterilization or non-thermal sterilization. Solid material filter media, filter cake, filtrate product, pure microbial free. Solid material solid more than 1% filtration, solid less than 1% clarification, solid liquid intermicellar ultrafiltration. Okay. A filter media help filtration. Example: membrane filter, pore size 0.2 micrometer to 0.4 micrometer, cellulose plus acetate, sintered glass, borosilicate glass, Fine muslin cloth, cotton cloth, filtration of a coarse particle. Filter paper, cotton wool, glass wool, prepared from fiberglass. Filtration of a corrosive liquid acid base. Asbestos, old filter media, sand. Filter rate 0.1 to 0.5%. Filter cake, decrease rate of filtration. Filter rate are chemicals, objective, improve rate of a filtration. It mixes with product, chemically inert, proper suspended with the product. Example, Kaisulgar, also called as diatomaceous earth, not more than 1%. Another filter rates, bentonite, talc, silica, asbestos, charcoal, cellulose, or perlite. Rate of filtration is directly proportional to area of filter media and pressure difference upon viscosity and filter cake. Other factor affecting thickness of cake, pore size. Mechanism of filtration, three mechanisms: large particle, medium particle, small particle. Large particle can't pass filter media. Okay. Straining mechanism, मॉडरेट पार्टिकल्स स्मॉल साइज ब्लॉक पोर्स वो बीच में फंस जाते हैं. मॉडरेट पार्टिकल्स. इंटेंगलमेंट फिल्ट्रेशन मतलब बीच में फंस जाना, उसको क्या बोलते हैं? इंटेंगलमेंट. स्मॉल पार्टिकल और मॉडरेट निकल जाते हैं. पार्टिकल पास थ्रू फिल्टर मीडिया थ्रू कंटिन्यूस स्ट्राइक. इम्पिंगमेंट. एंटेंगलमेंट बीच में फंस जाना, इम्पिंगमेंट फास्ट होना. फिल्टर मीडिया प्लस प्रोडक्ट अट्रैक्शन इंक्रीज. मीडिया ब्लॉक अट्रैक्टिव फोर्स. टाइप्स ऑफ फिल्ट्रेशन: surface filtration, screen filtration. Thin via membrane filter media. Depth filtration via sintered glass ceramic filter media. Thick filtration equipment, sieve mechanism, rotary filter. Drum filtration, cartilage filtration. In drum filtration, example, filtration of a penicillin. In cartilage filtration, parenteral filtration, thermolevel filtration. Vacuum mechanism, surface mechanism, leaf filter, sweet land filter. In pressure mechanism, surface mechanism, मेटा फिल्टर, प्लेट फ्रेम. theories of filtration, पकोड़ा ऑयल में फिल्टर करते हैं, लाइक पॉइसले, डार्सी एंड कोजनी कार्मन. पकोड़ा फिल्टर. ड्राइंग वाटर रिमूव और वेट मास सॉलिड सेमी सॉलिड या रिमूव मतलब स्लो करना, रिमूव करना वाटर को. इवेपोरेशन वाटर रिमूव फास्ट लिक्विड. ओके. और ड्राइंग मतलब मेनली सॉलिड्स में होगा और जो इवेपोरेशन होगा वो लिक्विड का होगा. टाइप्स ऑफ मॉइस्चर: बाउंड मॉइस्चर, अनबाउंड मॉइस्चर, फ्री मॉइस्चर, इक्वल मॉइस्चर और क्रिटिकल मॉइस्चर. प्योर वाटर मॉइस्चर, वाटर, प्योर वाटर. ओके. सॉलिड हाइग्रोस्कोपिक बाउंड मॉइस्चर, सॉलिड मास वाटर. सॉलिड नॉन हाइग्रोस्कोपिक अनबाउंड मॉइस्चर. वेपर प्रेशर ऑफ सॉलिड मास वाटर is less than vapor pressure of pure water. Vapor pressure of wet mass equal to vapor pressure of pure water because water no go inside and no contaminate. Okay, this is not important. Bound moisture, maximum heat, maximum time drying. Unbound moisture, minimum heat, minimum time drying. Heat drying, remove moisture from surface, free moisture content. Amount of water removed from substance, especially surface. Atmosphere moisture, wet mass moisture, equal moisture. EMC, constant, no FMC. Okay, EMC, FMC. Critical moisture, heat go out, heat average moisture content of a material at which the rate of a drying being slow or decline. Rate of drying rate, starting, secondary, falling line, primary falling line, then time decrease, constant drying, rate of drying, constant line, time increase, falling line, time decrease, constant time CMC, falling line, rate of drying is equal to weight of water in sample upon time weight of a solid mass. Loss on drying, remove water upon total mass of weight sample into percentage. Drying mechanism, diffusion drying, capillary drying, pressure gradient. In diffusion drying, high temperature to low temperature. In capillary, water removed by capillary pores. Pressure gradient, drying by sunlight, heat pressure. Types of dryer, convection, conduction and radiant. Radiant में एक ही एग्जाम्पल है माइक्रोवेव. कंडक्शन में फ्रीज, सब्लिमेशन, लाइफिलाइजेशन, वैक्यूम, स्प्रे, ड्रम, पैन. इन कन्वेक्शन, tray dryer, fluidized bed dryer, tunnel and rotary dryer. Tray dryer, self dryer, all solid type material, powder, granule, pills. Tunnel dryer, rotary dryer, sticky material plus wax. Fluidized bed dryer, air granules, fluid air plus product, fluidized suspended system. Used in a tablet granules manufacturing, fluidized bed dryer, FBD. Freeze dryer, application biological material, thermolabile product, milk, serum, blood, platelet, vitamin, protein, amino acid, enzyme, mainly for blood, freeze dryer. Vacuum dryer application pharmaceutical container, glass, plastic, metal, ceramic material. Spray dryer, pharmaceutical product, liquid and semi-solid, emulsion, lotion, suspension, paste, jellies, gel. Spray dryer, drum dryer, starch, antibiotic and milk. Next, extraction. Crude drugs extraction, remove active constituents. Solvent, menstruum. Example, alcohol and water mainly. Cake residue, murk. Undissolved material. Extract, dissolve material. Galenical process, extraction process. Galen, father of extraction. Infusion, decoction, digestion, maceration, and percolation are galenical processes. Means extraction process. Organized drug, direct plant part. Example, root, bark, leaf, stem, flower. Unorganized drug, extract, juices, latex, benzoin, secretion, gum. And infusion, decoction, digestion. Infusion, cold plus hot. Decoction, hot. Digestion, boiling plus pressure. 5 minute in a infusion, hot cold. 5 minute hot extract plus cold extract. Freeze within 12 hours. Use fresh infusion. Fresh infusion, maceration, 2 time, 3 time, double maceration, triple maceration. Concentrated infusion. Potency, concentrated infusion is greater than dilute infusion, 8 times more than a dilute infusion. Okay, potency. Decoction, hot boil water. Specific time 10 to 15 minutes. Filter, extract. Digestion, solvent boiling plus pressure. Filter, extract. Maceration, simple maceration, maceration with adjustment, multiple maceration, double and triple. Sunlight, solvent, ड्रग सॉल्वेंट, लीचिंग, मैसरेशन एक दूसरे में मिक्स हो जाते हैं. सिंपल मैसरेशन, ऑर्गेनाइज ड्रग. कोर्स ड्रग कन्वर्ट टू पाउडर ड्रग प्लस उसमें सॉल्वेंट ऐड करके मेन स्टम. मिक्स 7 day होल्ड. फिल्टर, मार्क, प्रोसेस, एक्सट्रैक्ट. जो सॉल्वेंट होगा उसको हम मेन स्टम बोलते हैं और जो केक बनेगा उसको बोलेंगे मार्क, प्रेस. मिक्सचर दोनों का. सिंपल मैसरेशन. मैसरेशन विथ एडजस्टमेंट प्रोसेस ऑन ऑर्गेनाइज ड्रग. पाउडर प्लस सॉल्वेंट. 4 to 5th 100%, 100%, 100 ml. Remaining 1/5 2 to 7 day rare stirrer. Filter, murk, not fresh. Volume plus again solid ऐड करेंगे. Multi maceration, concentrated. Double maceration, 100,000 million, 100 1100 ml solvent plus 100 ml. Total volume menstruum, volume written by drug upon 2. Double maceration, total menstruum minus volume written by drug upon 2 plus volume written by drug solvent added. Not it's important. Percolations, process percolation. उसको also क्या बोलते हैं? Laxation. Percolations, laxation. Menstruum, sand, wool cloth, extract. Simple percolations, reserve percolations, continue percolation, simple percolation, imbibition, drug dumping, maceration, percolation. Reserve percolation important नहीं है. Continue percolation, hot extraction process, socklet procedure. Okay. Condenser, timbal, side tube, vapor, siphon tube, extract, solvent, heat. These are the extraction. Dosage form, dose plus formulation, API, solid, liquid, gas, semi-solid. These are the formulation. And API, internally, externally, disease, diagnosis, treatment, prevention, mitigation. Classification of dosage form, solid, unit solid, tablet, capsule, powder, pills. Bulk solid, external, dusting powder, dentifrices, insufflation, snuff. Internal, fine powder, granules, effervescent granules. Gases, only one. Aerosols, liquid, monophasic, biphasic. In biphasic, emulsion, suspension. In monophasic, internally, external. Internally, syrup, elixir, linctus, drop. External, skin lotion, liniment, mouth wash, gargle, throat paint. Body cavity, duchess, enemas, ophthalmics, eye drop, ear drop, nasal spray. Semi-solid, external, internal body cavity. Internal only suppository, semi-solid. External, ointment, paste, jellies, powderized cream. Solid dosage form, unit, tablet, capsule, pill, round shape, mini tablet, pills, powders. Bulk, dusting powder, Use externally CU number 80 fast. Minimum ingredient 2. A drug plus additive. Types medical, surgical. In medical, superficial use, non-broken skin, and surgical on a broken skin, open wound. Dentifrices, tooth powder, clean teeth, shine increase. Main material of a dentifrice abrasives याद रखना. Calcium carbonate, sodium carbonate, magnesium carbonate, abra carbonate याद रखना. Insufflation, finely divided powder. Insufflator help. Place in a body cavity, vaginal, ear, throat. Snuff, fine powder. Take only with wire nasal cavity, oral cavity. Fine powder 85 number cu fast. Granules 10 number cu fast means highest. जितनी सी नंबर ज़्यादा उतना पार्टिकल छोटा होता है. फाइन पाउडर 85. कोर्स पाउडर मतलब ग्रैनुल्स. ओके 10 नंबर से उसे पास होनी चाहिए. स्टेराइल टेम्परेचर नॉट मोर देन 60 डिग्री सेल्सियस. इफरोसन ग्रैन्यूल्स सोडियम बाइकार्बोनेट, सिट्रिक एसिड, टार्ट्रिक एसिड, रिलीज कार्बन डाइऑक्साइड. एक कंटेंट याद रखना इफरोसन का. सोडियम बाइकार्बोनेट, citric acid and tartaric acid. And powder mixing process: trituration, spatulation, geometric dilution, shifting, tumbling. Trituration means mortar pestle, spatulation plate and spatula, geometric dilution for potent powder, and shifting mix via vibrator. In geometric dilution, potent powder plus one part diluent and plus second part diluent. Okay. Tumbling, mix in a wide mouth container. Liquid dosage form: monophasic, single phase, aqueous, non-aqueous. Syrup: saturated, concentrated, viscous, internal preparation. Main ingredient: sucrose. According to USP, 85% weight by volume, 64% 7 by weight. Cold process, light color. In IP, 66.7%. Hot process, dark color. Preservative IP added, USP not added because sucrose is a self preservative in there. Types: medicated syrup, flavor syrup, simple syrup. In medicated syrup, sucrose plus drug plus vehicles. In flavor syrup, sucrose plus flavor plus vehicle. Uh, simple syrup, sucrose plus vehicle. Method of preparation: cold method, hot with agitation, hot without agitation, percolation. प्रिजर्वेटिव कौन कौन से होते हैं सुक्रोज में, सिरप्स में? मिथाइल पैराबेन, प्रोपाइल पैराबेन, ब्यूटाइल पैराबेन, बेंजोइक एसिड, सुक्रोज, यूएसपी, and sodium benzoate. Elixir: sweet, clear, non-aqueous, hydroalcoholic preparation. Elixir hydroalcoholic. Types of elixir: medicated, drug plus ethyl alcohol. Flavored elixir: flavoring agent plus ethyl alcohol 5 to 40%. Elixir stabilizer: citric acid. Important: elixir stabilizer, citric acid. Method of preparation: dissolution with agitation. Linctus: relief cough, treat throat infection. Demulcents: कंटेंट 68% सुक्रोज, यूज एज अ प्रिजर्वेटिव. लिंक में कितना सुक्रोज होता है? 68% सुक्रोज, यूज एज अ प्रिजर्वेटिव प्लस ग्लिसरीन. ओके, लिंक से याद रखना ग्लिसरीन प्लस सुक्रोज. शुगर फ्री लिंक टेस्ट: बेंजोइक एसिड प्लस ग्लिसरीन. डोज स्मॉल 5 ml. मिक्सचर: ड्रग प्लस सॉल्वेंट vehicle. Types: internal, simple mixture, soluble mixtures. Mixture with diffusible solid, not easily dissolved with a solvent. Mixture with indiffusible solid, false mixture. Mixture with indiffusible solid, false mixture. Mixture with precipitate. External, use on a skin, lotion, liquid suspension, semi-liquid. Apply on a broken skin without friction or a lotion. Add humectant, softness, perfume, alcohol, cooling effect. Types: calamine lotion एंड वाइट लोशन. कैलामिन लोशन का कंटेंट क्या है? जिंक ऑक्साइड एंड आयरन ऑक्साइड, उसको हम फेरिक ऑक्साइड भी बोलते हैं. कैलामिन लोशन को 98% जिंक ऑक्साइड, 2% आयरन ऑक्साइड. प्रोड्यूस पिंक कलर बिकॉज ऑफ आयरन ऑक्साइड. लिनिमेंट सेमी सॉलिड, इम्ब्रोकैटायन. ओके, applied on unbroken skin with friction. Humectant oil, perfume not added, alcohol for cooling. Mouth cavity gargles, aqueous material used in a throat infection. Phenol plus thymol add for antibacterial action. Potassium chlorate astringent action. Instruction: dilute with warm water before use. Mouthwash: aqueous material, sweet, pleasant. Function: buccal cavity clean. Addition of additive: antibacterial agent. Throat paint: viscous preparation, treat throat infection. Main ingredient: glycerin. थ्रोट पेंट ग्लिसरीन और लिंक्टस में भी ग्लिसरीन था. ड्रॉट सिंगल डोसेज फॉर्म 50 ml. इंटरनल बॉडी कैविटी मोनोफेजिक. एक्सटर्नल nasal drop, nasal spray, enemas, Dutchess, ophthalmics. In nasal drop, aqueous preparation, non-oily, inhibition of a cilia movement in nose. If long time use goes in the lungs, cause lipoidal pneumonia. Most be isotonic, neutral in pH, viscous at similar nasal secretion, viscosity enhancer, methyl cellulose. Okay. uh, नेजल स्प्रे नेजल ड्रॉप में कौन होता है विस्कोसिटी इनहांसर मिथाइल सेल्यूलोज नेजल स्प्रे एक्वियस प्रिपरेशन अल्कोहलिक प्रिपरेशन glycerin in minor amount used mainly in throat paints applied on mucous membrane nose and throat with the help of a device atomizer enemas sterile solution cleaning rectal Dutchess sterile solution cleaning vaginal infection disadvantage about solubility monophasic completely soluble completely dissolved mild solubility increased solubility by hydrotrophy example co-solvent complexation and a solubilizer solubility parameter vf triple sweepy terms very soluble freely soluble soluble sparingly soluble slightly soluble very slightly soluble and practically insoluble uh, very soluble less than 1 freely soluble 1 to 10 soluble 10 to 30 sparingly 30 to 100 slightly 100 to 1000 very slightly 1000 to 10,000 practically insoluble greater than 10,000 biphasic emulsion and suspension semi solid paste ointment jelly gel powder essay suppository and cream semi solid emulsion O by W vanishing cream W by O cold cream mainly O by W before rubbing outer evaporation then its compound W by O cleansing cream W by O sunscreen O by W. Okay. Titanium dioxide used as a opacifier. Don't confuse between its cleansing cream W by O, sunscreen cream O by W. Paste finely divided powder solid 50% solid content in a paste. Mainly zinc oxide, calcium carbonate, starch, less oily than ointment. Toothpaste 1000 ppm fluoride. Okay, toothpaste. Jelly non-oily, non-greasy, transparent main ingredient, gelatin, starch, Poultice cataplasma, weight mass, apply on a painful body part. Poultice is cataplasma. Gel contains small organic material, large inorganic material, transparent. Status water absorb but volume not improve. Imbibition gel property. Water absorb and volume improve. Swelling gel property. Syneresis water absorb and shrink. Zero gel water remove from a gel. Thixotropy gel to solution gel again. Gel solution gel thixotropy. Next tablet unit solid dosage form tabula Latin word official shape of tablet according to IP biconvex oval oblong round flat cylindrical advantage easily taken dosage uniformity no contamination no dose variation low cost easy transportation self medication disadvantage not suitable for child patient slow action slow dissolution rate slow bioavailability not suitable for comatose patient not suitable for in emergency condition types of tablets oral oral cavity solution tablet other in oral tablet compressible tablet multi compressible tablet enteric coating sugar coating film coated chewable sustained release oral cavity sublingual buccal dental cone lozenges also called troches solution tablet dispersible effervescent tablet triturate and hypodermic other tablet implant and vaginal tablets compressible tablet ct additive plus api single api made by tablet compression method punch die for shape punch for pressing multi compressible tablet mct additive plus minimum 2 api maximum 3 api 2 to 3 times compression occur tablet in tablet also called multiple compression tablet or multi-layer tablet for 3 api called as a triple layer sugar coated tablet to prevent moisture environmental degradation enteric coated tablet to prevent acidic degradation film coated to prevent moisture degradation same as a sugar coated sustained release tablet or delayed release tablet or slow release tablet applied polymers coating on a tablet chewable tablet material use mannitol brand name perlitol mannitol used as a diluent mechanism of action of mannitol negative heat sensation cooling effect pleasant action sublingual tablet placed under the tongue example nitroglycerin buccal tablet placed site of a cheek vitamin c lozenges between gum and cheeks example strepsils and wicks another name pastille cough drop tablets groups of lozenges troches dental cone shaped cone like placed between teeth used for antibacterial analgesic action dispersible tablet 90% solvent dispersion effervescent tablets carbon dioxide release 30% solvent, and indispersible 90% solvents. Composition of eperosin: citric acid, tartaric acid, sodium bicarbonate. Sodium bicarbonate prevent interaction of a citric acid and tartaric acid. Tablet triturate, molded tablet require potent API. Potent API plus 70% alcohol. Convert moist to mast. Okay. Dry spoon are called as a tablet triturate. Hypodermic tablet, also called as a parenteral tablet, plus sterile, make solution. Inject under dermis layer of a skin. Tablet sterile water. Implant, place under skin by minor cut, subcutaneous layer. Use corn injector sterile tablet. Size not more than 8 mm. Shape round cylindrical. Half life 1 month or 1 year. Vaginal tablet. As similar vaginal suppository like pessaries. Additives grade A, grade B, grade C. Group first, group second, group third. In group first, diluent, binder, disintegrating agent, flow promoter. In grade B, sweetening agent, coloring agent, and flavoring agent. And grade C, polymer wax, diluent, bulking agent, fillers. General property: low cost, easily available, non-toxic, better acceptability. Do not alter bioavailability. Improve 5 to 80% bulk. Diluent, sugar base, polysaccharide, miscellaneous, inorganic. Sugar base: lactose, sucrose, dextrose, sorbitol, mannitol. Polysaccharide, starch, cellulose. Inorganic: dilute, dicalcium phosphate, dimagnesium phosphate, tricalcium phosphate, trimagnesium phosphate are inorganic. All calcium and magnesium. Miscellaneous: kaolin, bentonite, and silica. Sugar based diluents: lactose. Moisture content not more than 7%. On dry, spray dried lactose, SDL, 3% moisture. Types: hydrous lactose, 7% moisture. Anhydrous lactose, 0% moisture. Hydrous lactose plus amino group primary amine, furaldehyde gas release. Tablet chances into broken color surface, 1912 air Maillard reaction. For minimize Maillard reaction, we use anhydrous lactose. Grade of lactose: coarse lactose, regular lactose. Coarse lactose 60 to 80% mesh pass, and regular lactose 80 to 100 mesh pass. Sucrose used as a diluent, binder, and a sweetening agent. As a diluent, Diapac, Newtap, SugarTap. In Diapac, 97% sucrose, 3% modified dextrin. In a Newtap, 95% sucrose plus 4% inward sugar. And in SugarTap, 1%, 90 to 93% sucrose plus 7 to 10% inward sugar. Dextrose brand name cellulose and tapfin. Dextrose, cellulose and tapfin. Mannitol, perlitol. Sorbitol, isomer of a mannitol. Polysaccharide based diluent: starch, source, wheat, maize, potato, rice. Market brand name Amdex, Cellutap, Star RX 1500, Starch USP. Amdex and Cellutap. Hydrolyzable starch. Star RX 1500, direct compressible starch. Commercial starch. Moisture content not more than 10%. Starch USP, MC, moisture content 11 to 14%. Cellulose: AV cell, Viva cell, MO cell, MCC, microcrystalline cellulose. Grades of cellulose: pH 101, pH 102, pH 301, pH 302. Post graduation CA, PGCA, 101 पाउडर 102 ग्रैन्यूल्स 301 क्रिस्टलाइन 302 amorphous. Inorganic diluents: di, tri, divalent, trivalent, not suitable for tetracycline because it's make a chelate. Binders: improve cohesive strength of a granules, high amount hard tablet, less amount soft tablet. Optimum concentration of binder 10 to 25%. Weight binder acacia triacanth 10 to 25%. Disadvantage: microbes loaded, so sterile before use. Gelatin, sucrose, starch, paste, glucose, and water quantity sufficient. Dry binder cellulose and polyvinyl pyrrolidine. Disintegrating agent in stomach, tablet swell, burst. Starch USP 5 to 10 20%. Modified starch, Explotep or Primogel. Sodium lauryl sulfate, clay, or cellulose. A super disintegrating agent 30 times more powerful than a normal disintegrating agent. Sodium starch glycolate, cross carmylose, egg disol, cross carmylose, egg, याद रखना, cross povidone. Sodium starch glycolate, cross carmylose, egg disol, cross povidone. Flow promoter, glidant, antiadherent, and lubricants. Glidant reduce attraction between granules and granules. Antiadherent reduce attraction between punch and tablets. Lubricant uh, reduce attraction between dye and a tablet. GGG Glidant triple G ATP limited. Just short tricks. Triple G Glidant remove attraction between granules and granules. Antiadherent uh, punch and tablets. Okay, and lubricants diol and tablets. Glidants example aeroseal, siloid, aboseal, colloidal silica, 0.25 to 3%, talc 1 to 5%, or cornstarch 5 to 10%. Anti-adherent talc, cornstarch, lubricant all stearate materials. Group 2B additives, sweetening agent, coloring agent, and a flavoring agent. All are approved by US FDA. No pharmacological activity. Used only for improving organoleptic property. Sweetening agent, cyclamate, mannitol, saccharin, aspartate. Cyclamate 70 times, mannitol 72 times, saccharin 500 times, aspartate 200 times. Okay, cyclamate 70, mannitol 72, saccharin 500, and aspartate 250 times more sweeter than a sucrose. Standard sweetening agent sucrose, saccharin and aspartate disadvantage bitter after taste. Mannitol non-hygroscopic, non-carcinogenic. Cyclamate carcinogenic, hygroscopic. Saccharin carcinogenic, hygroscopic. Aspartate non-carcinogenic, non-hygroscopic. Coloring agent dye organic, pigment inorganic, lake organic. Dye outer dissolve, pigment outer non-dissolve, lakes precipitate. Dye under UV degrade, pigment under UV non-degrade, lake no effect. Dye plus precipitate salt, lakes. Lakes naturally obtained. Female insect example cochineal shellac. Dye red. Outer soluble amaranth eosin. Oil soluble sudanthid or tawny red. Okay, red dye. Outer soluble amaranth eosin and oil soluble sudanthid tawny red. Green dye alizarin. Black naphthol. Blue indigo. Yellow tartrazine. Flavoring agent salt, butterscotch, maple, wintergreen, apricot, mint, peach, and vanilla. Sweet, vanilla, berry. Sour, citrus flavor, licorice, root beer, raspberry. Bitter, wild cherry, walnut, passion fruit, anise, mint. Granulation, direct compression granulation, old method. Dry granulation, wet granulation, or moist granulation. Additive plus API, powder small, void space increase, air entrapment. Granules large, void space decrease air entrapment. Due to air entrapment, capping, lamination produce. Direct compression granulation, additive plus API, mix blending granules, tablet munching machine. Diluent for direct compression, starch and star RX 1500. First compressible tablet, paracetamol. Dry granulation, pre-compressed granulation, double compression methods. Drug grinding, suitable additive add, blending, roller compactor, formation of a slug or flat tablet, size reduction, again screening sieve, lubricant plus glidant add, granules, tablet punch, tablet. Machines, roller compactor, chilsonator. Moisture sensitive drug and heat sensitive drug prepared by a dry granulation method. Moist granulation, drug plus additive, mix binder, weight binder, weight mass drying 60 degrees Celsius, moist granulator machine, granules plus glidant plus lubricants. Machine, Little Ford, Diosna, Sigma Blade, Planetary, or Kral. Moist granulation not suitable for heat sensitive material, moist sensitive material. Okay. Dry granulation, acetyl salicylic acid, multivitamin. याद रखना. Dry granulation, acetyl salicylic acid, multivitamin. Wet granulation, antacid, acetaminophen, rifampicin. Direct compression granulation, vitamin C, antacid, sodium chloride, potassium chloride. Weight mass formation mechanisms, powder, weight binder, weak bond generation, pendular stage, increase binder, moderately bind together, funicular stage, increase binder, weight mass dissolve, droplet formation. Okay. Pendular weak cohesive, funicular capillary strong cohesive droplet formation. Navit mechanism, weight mass mechanism. Navit, rather to Navit mechanism, weight mass mechanism. Tablet punching machine, single punch machine, stamp press method, multi punch machine, multi press method, automatic fast output, slow output, automatic, semi automatic, punch, concave shape, flat, and die shape, uh, punch, brand name, symbol, design, company name for printing, punch, die for shape, oval, oblong, round, cylindrical, and flat for biconvex. Okay, biconcave punch, a lux engraving design, embossing, parley. Engraving means engraving, embossing, parley. A multi-punch machine, cam track, 9 tools, turret. Tools feed, die, pull down cam, wire blade, weight, upper, lower raise. This is not important. Cam track, guide the punch. Turret, support the punch. Die, shape, punch, compression. And turret, support the punch. And cam track, guide the movement. High punch compression, more binder, hard tablet. Tablet evaluation test, hardness, friability, dissolution, disintegration, content uniformity, weight variation. Evaluation parameters of a tablet. General evaluation, thickness evaluation text, upper thickness, micrometer, and side thickness, vernier caliper. Plus minus 5% variation allowed. Check with monograph and compare. This test also give idea about size and shape. Color evaluation test, color quantity check, analytical methods, reflectance photospectroscopy, tri-stimulus photospectroscopy, colorimetry photospectroscopy. Unique evaluation test to check sign, symbol, design later. It is eye observation test, D design, eye design. Okay. डिप्रेस एनग्रेविंग, इम्प्रेस, इम्बॉस. अगर नीचे जाएगा तो डिज़ाइन, डिप्रेस, एनग्रेविंग. ओके. और ऊपर होगा तो इम्प्रेस, इम्बॉस. स्पेशल इवोल्यूशन टेस्ट, हार्डनेस इवोल्यूशन टेस्ट, हैंडलिंग टेस्ट, ट्रांसपोर्टेशन टेस्ट, स्टोरेज टेस्ट एंड क्रशिंग स्ट्रेंथ. ऑप्टिमम हार्डनेस 5 to 8 kg per centimeter square. Unit of hardness kg per centimeter square. Hardness decrease 5 to 8 soft tablet, fast disintegration, and increase 5 to 8 hard tablet, no disintegration. Hardness tester Monsanto, Pfizer, Strong Cop, Sheluniger, and Erveka. Monsanto old screw drive, Pfizer plier mechanism, Strong Cop hydrolytic pressure, Sheluniger closed electronic device, and Erveka train and flat formation. Friability test, impact test, sticky test, attrition test, and friction test. IPBP non-official but USP official. Friability test. Single cycle 25 revolution per minute. Time 4 minutes. First round 25 into 4 100 round. Chewable tablet and ibuprofen tablets not perform friability test. Application apparatus Roche friablitter. Weight of tablet before friability 1000 mg. 100 round 1% reduction 90 90 mg. Acceptance criteria reduction not more than 0.5 to 1% according to SP. Percentage of friability initial weight minus final weight upon initial weight into 100. Disintegration test only for oral route tablet. 3 solvents water, neutral, zero point 0.1 normal HCl acidic drugs, phosphate buffer solution PBS, PBS phosphate buffer solution base basic drugs, 1000 ml 1 liter temperature 37 plus minus 2% degree Celsius, 2.5 centimeter. Up down sieve number hashtag 10. 6 tubes, each tube 3 inch. Up down 28 to 32 cycle per minute. Okay. 3 inch. Sustained release tablet, chewable tablet, not disintegration test. Disintegration time. Dispersible tablet 3 minutes. Ibuprofen tablets 5 minutes. Uncoated tablet 15 minutes. Film coated 30 and sugar coated 60. Like capsule, soft gelatin capsule 60 minutes and hard gelatin capsule 30 minutes. Okay. These are the disintegration time. Dispersible 3 minutes, effervescent 5, uncoated 15, film 30, sugar 16. Enteric coated 3 hour, water zero point 0.1 normal HCl and PBS. Polymer enteric coated tablet, IP 3 hour, USP 3 hour. Oral water zero point 0.1 normal HCl, stomach rest 1 hour, 2 hour, small intestine. Disintegration acceptance criteria. First stage, all 6 tablets disintegrate at a specific time pass. If one or two tablets not disintegrate at a specific time, go to second stage. First stage, second stage, 12 new tablet, all disintegration integrate, disintegrate at specific temperature, test pass. One or two not disintegrate at specific time, test fail. First stage 6 tablets, second stage 12 tablets, total 18 tablets. Dissolution test or in vitro bioavailability test. 50 to 100 revolution per minute stirrer. Capacity of vessel 1000 ml. Zero point 0.1 normal HCl water PBS 900 ml. Temperature 37 to plus minus 0.5 degrees Celsius. Gold coating 2.5 mm. Okay. Dissolution type USA. Type 1, type 2, type 3, type 4, type 5, type 6 and type 7. Type 1 USA BP like a basket, paddle, reciprocating cylinder, flow through cell, paddle over disc. 5 paddle over disc, 4 flow through cell, 3 reciprocating cylinder and 6 rotating cylinder. Okay, and 7 reciprocating holder. So 3 and 6 are both are cylinder. Just remain 3 and 6 cylinder, but 3 reciprocating and rotating. First basket, paddle, reciprocating cylinder, flow through seal, paddle over disc, rotating cylinder, reciprocating holder. In IP type 1, paddle, basket, another or same. Dissolution test, tablet API release IP, dissolution QT, USP Q, quality dissolve. First is 6 USP, mesh 14, HPLC UV, quantity analysis drug API. Each unit dose not less than quantity plus 5%. Second, 6 old, 6 new, 12 tablets. All 12 unit equal than Q, more than Q. No unit less than 15. Okay. S3, S1, S2, S3. 24 tablets. All 24 unit quantity not less than 0.9. No unit not less than Q.5. Weight variation test 20 tablets. To check of a drug, to check weight variation of a drug. Condition IP, percentage of variation, and condition USP. In a condition IP, less than 85, 85 to 250, greater than 250. If less than 85 mg tablets, then plus minus 10% variation. It's good. 85 to 250, 7.5. Greater than 250, plus minus 5. 130 to 325. Okay. In USP, percentage weight variation, average weight into 5 upon 100. So average weight 290. Okay. Average weight, upper limit average weight plus weight variation, lower limit average weight minus percentage of weight variation. So upper limit, lower limit. Acceptance criteria, not more than 2 tablet across the upper limit, not more than 2 tablet across the lower limit. Upper limit pass, lower limit plus, excellent. Upper limit pass, lower limit fail, good. Upper limit fail, lower limit pass, good. Fail, though both limits were poor. Content uniformity test, 30 tablets. First stage 10 and second stage 20. To check amount of drug by HPLC and UV. Assay 10 tablet, all tablet not less than 85%, not more than 115%. Second stage 20 tablets, not less than 75%, not more than 120. Tablet defects, capping, separation of upper or lower layer, separation of top or bottom portion of a tablet are called capping. Lamination, separation of more than one layer, top or bottom layer of a tablet, more than one. Okay. Lamination, reason air entrapment, remedy granule material, pre-compressed granulation or dry granulation. Okay. Next, using flat punch. Sticking tablet material adhere with dye. Picking tablet material adhere with punch. Sticking, picking. Reason design availability, emboss, engraving, remedy, designless tablet. High moisture material, remedy, low moisture material, mild drying. Non coated dye, punch, remedy, coating, dye, tungsten, and punch, chromium. Dye, tungsten, and punch, chromium. Mottling, unequal distribution of a coloring material in surface of a tablet. Mottling, unequal distribution of a coloring material in surface of a tablet. Reason unequal distribution, remedy proper distribution. Dehydration remedy using only stable coloring material. Arching breaching, flow stop weight variation, granule separate of a neck of the hopper. A rat hole defect, arching and breaching. Rat hole defect, particles segregate at all of the hopper and center hole continue form. Reason moisture granule using dry granules, addition of a glidant, double impression, two times punch at the same place. Reason not proper working, proper work. These are the tablet coating benefits: product identification, improve mechanical strength, mask unpleasant taste masking, prevent acidic degradation, enteric coating, improve extend release, increase stability. Tablet coating, it is a mixture of various substances called coating material: polymer, wax, solvent, coloring material, plasticizer, and resin. Types of a tablet coating: old method sugar coating, bulk material plus tablet, and a new method film coating, non-enteric and enteric. Enteric acidic prevent small intestine. Acid not release, normal disintegration pathway. Sugar coating 5 steps: sealing, subcoating, syruping, finishing, and polishing. Sugar coating 5 steps. Remember, sugar coating 5 steps: sealing, subcoating, syruping, finishing, and polishing. Sealing to prevent moisture degradation. Shellac, zinc, oleic acid, polyethylene glycol, methyl chloride, and alcohol. Sealing to prevent moisture degradation. Shellac, zinc, oleic acid, polyethylene glycol, methyl chloride, and alcohol. Subcoating to make round uniform edge. Bulk improve size increase 5 to 80% increase weight. Gelatin, sugar cane, cornstarch syrup, gum acacia water. Syruping smoothing step, improve imperfection caused by a subcoating. Example: calcium carbonate, corn syrup, coloring material. Uh, Grossing syruping, suspended powder without agitation. Okay. Finishing, cotton, king of a powder, dusting powder. Rubbing, uniformity coating. Polishing, prevent shine, carnauba wax, beeswax, paraffin wax, naphtha wax. Next, film coating, non-enteric coating material. Example: HPMC, methyl hydroxy, ethyl cellulose, hydroxypropyl cellulose, sodium carboxymethyl cellulose, polyethylene glycol or acrylate, mainly cellulose. Remember, non-enteric cellulose. HPC, soluble 40 degrees Celsius, insoluble 45 degrees Celsius. Ethyl cellulose, water insoluble, soluble in 30% ethanol. Povidone grade K, 15, 13, 45, 60, 90. Viscosity increase, like increasing. Chemically, it is 1 vinyl to pyrrolidine. Povidone. Chemically, it is 1 vinyl to pyrrolidine. Acrylate, Udrazit E, Udrazit RL, Udrazit RS. Nature organic. Acrylate, Udrazit E, dimethyl amino methacrylate. Udrazit R and L liquid as solution, synthesized by acrylate methacrylate. Non-enteric polymer, disintegrate at pH below 5, means in acids like stomach. Enteric coating polymers, like mainly phthalate. Remember phthalate, cellulose acetate phthalate, HPMCP, pH 5 to 5.5, polyvinyl acetate phthalate, acrylate udrazit. Cap aquateric, HPMCP, HP50, HP55, udrazit L, udrazit S, acrylate, pH 6 to 7, basics. Coating solvents used in a tablet coating: water, ethanol, isopropyl, acetone, and chloroform. Coating solvents used in tablet coating: water, ethanol, isopropyl, acetone, chloroform. Plasticizer 1 to 50%. Castor oil, castor oil, polyethylene glycol, glycerin, twin span surfactant, most widely used in a full film coating, plasticizer. Tablet coating machine, standard coating pan for a perforated coating. Standard Pellegrini coating, immersion sword, immersion tube. In perforated, axilla cotta, dry coater, high coater. Standard coating pan system, also known as a conventional coating pan system. Dump coating material. Okay, diameter 8 to 16 inch, pan round circular, kg, metal stainless steel. 40-degree tilt, rotation axis horizontal. For 2 kg tablet, half liter coating material. Disadvantage not uniform coating because mixing problem. Pellegrini immersion sword immersion tube. In Pellegrini, horizontal axis 10 kg 10,000 kg increase. Sugar coating not suitable for film coating. Pellegrini because drying problem. Disadvantage mixing problem. Spray nozzle high pressure airless nozzle, low pressure air atomizer nozzle. Perforated system equipment drum perforated drum. Coating material spray by nozzle suitable for all types of tablet. Rotary axis horizontal. Axilla cotta, dry cotta, high cotta. Tablet coating defects sticking, picking, twinning, and chipping. Okay, sticking more than 2 tablets, picking tablet adhere with punch, twinning only 2 tablets, chipping a lot of tablets, chipping. Reason added high amount of a coating material, reduce drying rate, not proper mixing. Solution low amount of coating material, improve drying rate, proper mixing. Orange peel defect, orange peel defect. Pan fast move, tablet fast mix, slow move, tablet slow mix. Unequal distribution of a coating material in surface of tablets are called orange peel defect. Reason irregular speed, viscous coating material, unequal distribution coating material. Remedy regular speed using low viscous material, equal distribution of coating material. Roughness defect, dry air in, nozzle, hot air out. Film being rough, non-glossy, called roughness. Reason maximum distance between nozzle and tablet bed, high drying rate. Remedy minimize distance between nozzle and tablet bed, low drying rate. Blistering defects, detachment, local detachment of a film and a foam blister. Reason overheating, remedy mild heat. Huzzling, huzzing dull defect, blooming. Storage heat, coating material become dull, attach to your finger. Reason prolonged storage at high temperature. Remedy storage at optimal temperature, added optimum concentration. Bridging, bridge like engraving. Coating material develop thin layer over the later. Bridging. Filling, coating material filled in a later, like bridging and filling. Reasons letters present, engrave designing. Remedy later absent, emboss design. Engrave, emboss in, engrave niche. Okay. Bridging and filling. Cratering, not proper drying, volcano like defect. Cratering, remedy sufficient drying. Whiskering, cratering, now whiskering, thick coating, dry, hair like crack on a surface. Whiskering, reason a thick coating, a remedy thin coating. Just remember whiskering, whiskering, thick coating, hair like hairline crack on a surface. Reason thick coating, thin coating, cratering, volcano like defects, not proper drying. Next, next emulsion W by O, O by W, two phase, dispersing phase and dispersing medium. Okay, DP internal discontinuous phase, disperse medium external continuous phase. Its emulsion is a biphasic system, liquid in liquid system. Classification of emulsion: dosage form oral O by W, topical skin absorption cosmetic emulsion, and parenteral intradermal subcutaneous intramuscular IV no emulsions. Emulsion suspension by 3 routes ID subcutaneous intramuscular. Cold cream W by O, cleansing cream W by O, vanishing cream O by W, and sunscreen O by W. Okay. Cold cream O by W, rubbing action on body, water evaporate on body W by O. Cold cream W by O. According to phase, internal external. Double phase, oil base W by O, water base O by W. Triplet phase W by O in W, O by W in O. Sustained release emulsion. Hydrophilic barrier affected O by W. Lipophilic barrier affected W by O. Unstability step of emulsion, oil disperse phase, water disperse media. Okay. After that, mid chain form, mid, that's called flocculation. After flocculation, upward O by W, if downward W by O. Oil O by W upper, downward W by O. Creaming, creaming is a reversible. Okay. Upward O by W. Disperse phase make large globules coalescence. First one is a flocculation, creaming, coalescence. After coalescence, breaking, cracking, and that's phase inversion means degradation of emulsion. W by O converted to O by W, and O by W converted to W by O. Flocculation and creaming, it's a reversible process. Coalescence, breaking, cracking, phase inversion, irreversible. Stability methods of emulsion: monomolecular method, multimolecular method, solid adsorption method. Okay. In monomolecular method, chemical agents, emulsifying agent, emulsifiers are added. Surfactant example: sodium stearate, C18H35 double bow Na, fatty acid, hydrophilic head, and tail lipophilic. Okay, hydrophilic head, tail lipophilic. Cationic, anionic, amphoteric, and non-anionic surfactant, miscellaneous, spherical structure. Surfactant formation of a micelles amount, critical micelle concentration. The amount required to formation of a micelles from a surfactants. Monomolecular generate repulsion force between two dispersed phase particles, reduce interfacial tension between dispersed phase and dispersed medium, protection of a dispersed phase. Multimolecular method W by O. Hydrophilic colloids use tragacanth, acacia example, oil water. Multimolecular hydrophilic colloids, multiple layer, no attraction between two dispersed phase. Solid adsorption method, solid particles, magnesium hydroxide, magnesium trisilicate. Types of emulsifiers, natural, plant, acacia, tragacanth, agar, starch, and gum. In animal, gelatin, wool fat, egg yolk. Semi-synthetic, methyl cellulose, carboxymethyl cellulose, sodium carboxymethyl cellulose. Synthetic, in which synthetic, first one is anionic, all sodium, cationic in all cetrimide, like in anionic, sodium, sodium lauryl sulfate, sodium dodecyl sulfate, sodium palmitate, sodium stearate, and sodium oleate. In cationic, cetrimide, cetyl derivative, benzalkonium chloride, cationic. Non-ionic, twin, span, mirch, and bridge. Amphoteric, only one lecithin. Method of preparation: small scale and large scale. In small scale, dry gum method, wet gum method, and bottle gum method. In large scale, homogenizer, ultrasonification, and magnetic stirrer. Small scale method, FMUO, depend upon primary formula of emulsion, type of oil, oil, water, gum, olive oil, volatile oil, mineral oil, and fixed oil. Olive oil, water and gum same proportion, 2:1. Only oil changes. In olive oil 1, volatile 2, mineral 3, and fixed 4. Next, small scale manufacturing. A dry gum method, gum, oil, mucilage O plus gum, oil plus gum, वाटर इमल्शन. ड्राई गम वाटर बाद में ऐड करना, वेट गम में पहले वाटर ऐड करना, वेट, उसके बाद म्यूसिलेज में ऑयल ऐड करना, इमल्शन. बॉटल में गम प्लस ऑयल प्लस वाटर फॉर वोलेटाइल इमल्शन, नो कंटेमिनेशन मेथड. क्लोज मेथड, फोर्स मेथड ऑल्सो कॉल्ड. बैटल बॉटल को क्या बोलेंगे, फोर्स मेथड. लार्ज स्केल मैन्युफैक्चरिंग, होमोजेनाइजर मेड अप ऑफ टीन प्लेट और मिक्स इमल्शन, 15 to 5000 psi equal. After that, mix globules same size. Advancement, Silverson homogenizer. Ultrasonification works on a vibrational mechanism, 20 to 2000 Hz. Heat decrease, 20 to 17,000 Hz. Rapsonification. Evaluation of emulsion, dilution test, O by W and W by O. Water dilution, then it's a O by W. Oil dilution, then it's a W by O. In water, no dilution, W by O. In oil, no dilution, then it's a O by W. Next, dye test. Water soluble dye, amaranth. Oil soluble dye, Sudan third, Tony red. Tony red. WSD, random red. Water solubilization test, random red, W by O. All red, O by W. Conductivity test, confirmatory test for O by W. Conductivity, because in water conductivity is fast. Cobalt chloride test, confirmatory for O by W, same. Cobalt chloride mix paste blue, O by W 2 to 3 drops, paste paper pink color, then it's a O by W. Fluorescence test for W by O. W by O, W by O, 2 slides. Fluorescence light chamber. If light reflection, then it's a W by O, confirm. Next, Narcotic Drug and Psychotropic Substance Act 1985. Opium, opium OP, coagulated juice of opium poppy. Cut, nuster, and collect charpula. Chemical constituents in opium: morphine, codeine, thebaine, and heroin. Heroin is a semi-synthetic. Morphine not less than 0.2%. Prepaid opium, opium suitable for ash remaining after smoking. Opium dross like smoking. Poppy straw, all parts of opium poppy except seeds are called a poppy straw except seeds. Cannabis Indian hemp, also called ganja, flowering or fruiting top except leaf, are called ganja except leaf, flowering and fruiting tops. Charas, crude or purified resin. Hashish oil, concentrated resin. Coca plant, any plant of genus Erythroxylon, genus family species. Coca constituent, cocaine not less than 0.1%. Ecogene, coca leaf, any leaf from which cocaine and its derivatives are not extracted. Okay. Coca leaf, any leaf from which cocaine and its derivatives are not extracted are called coca leaf. Liquid hashish, hashish oil, both are same concentrated resin. NDPS Commissioner appoint under Section Opium Act 1857, Opium Act 1878, and Dangerous Drug Act 1930. These are the three drugs. And Poisonous Act 1919. So Dangerous Drugs Act 1930, Opium 1857. After that 1878. Offenses and penalties. Offense, galti, crime. Contravention, ullangan. So penalties, saja, imprisonment and fine. Contravention of rules related to opium poppy, cannabis, poppy straw, coca plant, except ganja. Then first offense. Okay. Offense penalties. First offense, fine up to 1 lakh or 10 to 20 year imprisonment like jail. Subsequent offense, fine up to 2 lakh or 15 to 30 year imprisonment or both. Ganja, first offense 50,000 fine or 5 year imprisonment or both. Second offense, up to 1 lakh fine or 10 year imprisonment or both. Servant offense, 5 year fine both. Obstructing inspector, illegal transport. Financing import export. Subsequently, opium, cannabis, coca, except ganja, death penalty. Small quantity for self consumption, diacetylmorphine, heroin, cocaine, morphine. 1 year imprisonment, fine up to 1000 or both. Other than uh, other than diacetylmorphine, cocaine, and morphine in small quantity, 6 months fine or both if no penalty is defined. Abatement, uksana, abatement or criminal conspiracy, same as a offense. Attempt to commit offense, same as a offense. Preparation of an offense, half of the offense. Next, Drug and Cosmetic Acts Act 1940, Rules 1945. Schedule, first ASU books, list of authoritative books in Ayurveda, Siddha, and Unani. This comes under first schedule. And second schedule, imported drugs, sale, stock, and exhibition. Drug and Cosmetic Rules 1945. A. Application form specimen. B. Fees to be paid for analysis in a central or state laboratory. C. List of biological and immunologicals whose import, sale, distribution is governed by special provision. C1. Only biologicals whose import, sale, distribution is governed by special provision. C. Vaccine and C1 insulin. Okay. C. Vaccine, C1 insulin. D. List of products exempted from complying with rules for import. Okay. Exempted import. And K. Exempted export. LIE lie, jhute, omit in a June 1982. Okay. Lie drugs are omitted in 1982. Even list of poisonous substances used in ASU like Ayurveda, Siddha, and Unani. F. Standard for running of blood bank. F1. A veterinary doctor. F2. Standard for surgical dressing. F2. Surgical dressing. F3. Umbilical tapes. And F4. Double F. Ophthalmic products. Okay. These are the F schedules. Veterinary doctor F1, F2 surgical dressing and umbilical tapes F3. Double F ophthalmic products F1 part 1, 2, 3. Bacterial and viral vaccines, sera and diagnostic agent from bacterial origin. Part 1, part 2 and part 3. Bacterial and viral vaccine, sera, diagnostic agent and bacterial origin. G. List of substances which should be used only under medical supervision and which are to be labeled accordingly. H. List of prescription drugs sold only against prescription of a registered medical practitioner. J. Disease or ailments which a drug may not purport to prevent or cure. K. Drug exempted from certain provisions relating to manufacturing of a drug. M. GMP requirement of factory premises, plants and equipments. M1, M2, M3. Homeopathic preparation, cosmetic and medical devices. So GMP first, homeopathic, M2, cosmetic and M3 medical devices, GMP. N. List of minimum equipment for efficient running of a pharmacy. O. Standard for disinfectant fluid. P. Life period of drugs. P1. Pack size of drugs. Q. List of coulter colors permitted to be used in a cosmetics. R. Standard for a mechanical contraceptive. And R1 standard for a medical devices. Okay. R mechanical contraceptives in which all condoms also present. In R1 medical devices only. And GMP M3. S standard for cosmetic. And M2 for GMP for cosmetics, homeopathic, cosmetic and medical devices. T. Requirement of factory premises and hygienic condition for ASU drugs. U. Particulars to be shown in manufacturing, raw material and analytical records of drugs. ये ऐसे में T hygienic बनाते हैं. U. Particulars to be shown in manufacturing, raw material and analytical records of drugs. U1 same as a cosmetics particulars. V. Standard for patent. W. Generic name. Omit in February 2000. Okay. X. NDPS list of drugs whose import, manufacturing and sale, labeling, packaging are governed by special provisions. Y. Clinical trials. Short recap schedules. A. Application pre-form. B. Fees for test by CDL and government analyst. Central Drug Laboratory, Kolkata. C. Biologicals and immunologicals. D. Exempted import. E1. Poisonous ASU drugs. F. Blood and blood bank. F1. Vaccine, sera, diagnostic agents. F2. Surgical dressings. F3. Umbilical tapes. F double F. Ophthalmic preparation. G. Use under RMP. H. Prescription drugs. J. Jabarjandu. K. Exempted manufacturing. And D. Exempted imports. M. GMP, M1, M2, M3. Homeopathic, cosmetic and medical devices. N. List of minimum equipments. O. Disinfectant fluid. P. Life period of drugs. P1. Pack size of drugs. Q. Coulter colors in cosmetic. R. Standard mechanical contraceptive condoms. R1. Medical devices. S. Cosmetic. T. GMP ASU drugs. U. Particulars to be shown in a manufacturing, raw material and analytical records. U1 same as a cosmetic. We patent generic name NDPS drug clinical trials. X NDPS drugs. Okay, narcotic drugs. W generic name and omit in 2000. Y clinical trials. Consumer Protection Act 1986. CPA. Consumer Protection Act 1986. Consumer who uses a product or use with the permission of a buyer. Goods. Any movable property including shares excludes auctionable goods. Services, transportation, telecom, teaching, etc. Excludes free of cost personal contract of a service. Nature of complaint: unfair restriction trade practice, defective goods replace, deficiency in service reservice, high price charge refund, injury or loss due to poor good service compensation. Three-tier court system: National Consumer Complaint Redressal Forum 20 lakh plus claim, state court 5 to 20 lakh, and district court less than 5 lakh. Okay. Written complaint: handwritten type, individual, state government, central government, consumer organization. Quadraplate: 4 copies of complaint, nature of complaint and relief required. 90 days judgment, 150 days sample analysis. Consumer Protection Council: state and central government को advise on policies related to Consumer Protection Act 1986. Consumer Protection Act 1986: no stamp or court fee. Cost of filing and pursuing the complaint can be claimed. Hazardous goods or life-threatening goods. Nature of complaint: withdrawal of a complaint. मैजिक रेमेडीज एक्ट 1954. अभी ऊपर क्या देखा था? ड्रग कंज्यूमर प्रोटेक्शन एक्ट 1986, मैजिक रेमेडीज एक्ट 1954 और ऑब्जेक्शनेबल एडवर्टाइजमेंट एक्ट 21 of 1954. Rules 1955. Section 16 Central Government. Section 3 Advertisement, Diagnosis, Mitigation, Treatment of a certain disease. Section 4 False character of a drug. Section 5 False magic remedy. Section 6 Import Export of a advertisement. Offense and penalties: first, 6 months imprisonment, fine or both. Subsequent, 1 year imprisonment or fine or both. Magic remedy: miraculous power like mantra, bhasma, tilisma, kavacham. No court lower than presidency registration. Registrate cannot run the case. Presidency registrate. Schedule J: 56 diseases. Advertisement: any form of communication. Important years: in important years: 1919 Poisons Act, 1940 DNC Act, 1941 DTAB Drug Technical Advisory Board, 1941 Drug and Cosmetic Bill, 1945 DNC rule. So in important years: 1919 Poisons Act, 1940 DNC Act, 1941 DTAB, 1941 DNC Bill, and 1945 DNC rules. In 1948, three acts: Factories Act, Pharmacy Act, and Minimum Wages Act. 1954, 4 Education Regulation. 1954 Magic Remedies Act. 1954 Prevention of Food Adulteration Act. 1954 Objectionable Advertisement Act. 1955 Rules of a Magic Remedies Act. 1955 Medical and Toilet Preparation Act, MTP Act. 1956 Rules of a Medical and Toilet Preparation Act. 1970 Indian Patent Act. 1971 Medical Termination of a Pregnancy Act, MTP Act 1971. 1975 MTP Act Rules. 1985 NDPS Act. 1960 Prevention of Animal Cruelty Act. 1857 Opium Act. 1930 Dangerous Drugs Act. 1949 PCI. 1975 GMP. 1979 and 2003 Drug Price Control Order. And some acts are here. 1911 Design Act. 1957 Copyright Act. 2011 Food Safety and Standard. 1950 Trade and Merchandise, and 1994 Transplantation of a Human Organ Parts. Next, PCI, Pharmacy Council of India, also called Central Council. First time constitute 3rd August 1949. Constitute for 5 years. Comes under Section 3. Total members 20. elected 8, nominated 9, and ex officio 3. So elected at least 4 teacher elected by UGC, 1 elected by Medical Council of India, 1 registered pharmacist each state. Nominated 9, 6 at least 4 degree diploma, central government, 2 1 from UGC and 1 from AICT, and 1 from each state. Ex officio only 3 PCI. Director General of Health Service, CD, CDL Director Central Drug Laboratory, and DCI Drug Control of India. Next, State Pharmacy Council, 17 members, elected 7, nominated 5, and ex officio also 5. Elected 6 registered pharmacist of state, 1 by Medical Council of India, nominated 5 by state government, at least 3 possessing degree diploma. Ex officio Chief Administrative Medical Officer of a state, in charge drug control organization and government analyst. Next, Prohibition Magic Remedies Act 1954, prevention of a miscarriage in a woman, improvement in sexual pleasure capacity of a human being, conception in a human claim. Section 3456, 3 disease, 4 false claim, 5 magic remedy, 6 import export advertisement. And disease claim, magic remedy, and import export advertisement. Medical and Toilet Preparation Act 1955 and Rules 1956, enforced 1st April 1957. Excise Duty Act, a medicinal preparation, any drug for cure or treat of a disease in a human. Toilet preparation, any preparation used in a toilet of human beings. Contain alcohol like deodorant, perfume, cleansing of skin, teeth, hair, alter complexation. Excise duty, deal with alcohol containing products. Alcohol, C5H5OH ethyl alcohol, C3H5OH ethyl alcohol. Non-bonded laboratory factory duty has been paid, and bonded laboratory factory duty has been not paid. Gauge measurement of a capacity of a cask. Measure of the cap of a cask. Cask wood container, 9 bottles, quarter. Period of 3 months starting 1st Jan, 1st April, 1st July, and 1st October. 3 months. Denatured spirit, alcohol unfit for drinks by addition of a approved material. Rectified spirit, plain unnatured alcohols, 50% overproof or less. Excise officer commissioner sample 227 ml. Standing committee advise central state government about administration this act. Restricted, unrestricted, any other advice. Standing members, a DCGI, one pharmacologist, one person from indigenous system of a medicine, Ministry of Health and Labor Welfare. Absolute alcohol 150 degrees Celsius alcohol. Offense and penalties. General penalty, penalty not defined, then 1000 rupees. Of disclosure of information by excise commissioner, 1000 rupees. Offense a relation to warehouse, 2000 rupees. Alteration in layout, opening of layout without permission, movement of goods without permission, failure to pay excise duty, observe license condition, 2000 fine 6 months. False information, search, arrest, 2000 fine to air. Obstruct officer, fine up to 5000. Failure of excise officer to do duty, 3-month imprisonment or fine of a 3-month salary or both. Drug Regulatory Agency, USA, US FDA, UK, MARA, Australia, TGM, India, CDSO, Europe, EMA, Brazil, ANVISA, Japan, PMDA, New Zealand, MedSafe, Singapore, HSA, and Pakistan, DRAF, Malaysia, NPRA, that's not important. Quality guidelines, total 12, total 14. So Q1 stability, Q2 analytical validation, Q3 impurities, Q4 pharmacopoeia, Q5 biotechnology products, Q6 specifications, 7 good manufacturing practice, 8 pharmaceutical development, 9 quality risk management, pharmaceutical quality system, 10 Q11 development and manufacturing of a drug substance, Q12 life cycle management, Q13 continuous manufacturing of a drug substance, and Q14 analytical procedure development. Climatic zone conditions 1, 2, 3, 4A, 4B. 1 temperate, 2 Mediterranean subtropical, 3 hot, dry. 4A, hot, humid, tropical. Hot, higher humidity. Temperate, Mediterranean, subtropical. General purpose, long term, 25 plus minus 2, 16 relative humidity, 12 months. Intermediate, 30 plus minus 2. Accelerated, 40 plus minus 2. General purpose and refrigerator, long accelerated, 25 plus minus 2, and freezer, 20 plus minus 5. Forms for import of drugs, C and C1 apply 8, grant 10. X apply 8A, grant 10A. Drugs for testing and analysis, apply 12, grant 11. For personal use, apply 12A and grant 12B. DTAP, Drug Technical Advisory Board, ex officio members, total 8. Drug General of Health Service as a chairman. Drug Control of India, Director of Central Drug Laboratory, Kolkata. Director of Central Research Institute, Kasauli. Director of Indian Veterinary Research Institute, Ajatnagar. And Director of Central Drug Research Institute, Lucknow. President, Medical Council of India. President, Pharmacy Council of India. Some NIPER POIQs, ICHQ9, QRM, ICHQ8, Pharmaceutical Development, Schedule Y, Clinical Trial, Form 30, Application for Manufacturing Drug for Test and Analysis, GMP, Schedule M, and Abbreviated New Drug Application, Application for ANDA, Form number 356, our H medical device import under FDA, a license for manufacturing is granted, Form 46. Schedule R, contraceptive. Schedule R1, medical device. CDRH, branch of USFDA for medical device. Imported, published by IP, published by PCI. Central Drug Testing Laboratory, Hyderabad.